the City Council of Charleston to order. Madam Clerk, would you please call the roll?
Yes. Councilwoman Del Chapo.
Here.
Councilmember Shealy.
Here.
Councilmember Saccharin.
Here.
Councilmember Mitchell.
Here.
Councilmember Brady.
Present.
Councilmember Gregory. Councilmember Waring.
Here.
Councilmember Seekings.
Here.
Councilmember Shade.
Present.
Councilmember Griffin.
Here.
Councilmember Appel.
Here.
Councilwoman Jackson.
Here.
Mayor Tecklenburg.
Here. Thank you, Madam Clerk. Now, if y'all would like to join us, Councilmember Shealy will lead us in an invocation.
Thank you, Mr. Mayor. Let us pray. Our dear Heavenly Father, you are almighty and you've told us you'll always be with us. Thank you, Lord. Lord, we thank you for the blessings of this day. We thank you that we're each blessed enough to be here and healthy in this meeting tonight. We ask your mercy on those who are ill. We ask that you'll give them strength that they need and that you'll grant them peace, comfort, and healing. We pray for those who've lost loved ones recently. We ask that you'll surround them with your love and that you'll comfort them, Lord. And please be with our first responders, nurses, and doctors. Grant them the mental, physical, and emotional wellness and strength that they need, Lord. Be with our hospital administrators who's making tough decisions. And we ask for your blessings on our business owners who are struggling and others that are struggling financially, Lord, that you'll be with them. Lord, please give us wisdom to find ways to stop this virus that's harming so many people. Lord, we ask that you'll help us replace anger and resentment with peace and healing, that you'll replace our lack of understanding with clarity. Lord, we ask that you'll guide us tonight and for your will to be done. For it's in your holy and precious name we pray. Amen.
Amen.
So once again, probably barely in the distance, you can see I have an American flag back here. If you would join me for the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the
republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So we have a few presentations and recognitions this evening. Haven't had those in a couple of meetings. So first is a proclamation recognizing Takiyah Cohen, who is a constituent of Councilmember Shealy's, and she's a remarkable young lady. And I think she joins us tonight by Zoom meeting as well. So Councilmember Shealy, could I call on you first to introduce us all to Takiyah, and then I'll read the proclamation.
Yeah, thank you, Mr. Mayor and colleagues. Appreciate you allowing us to honor Takiyah tonight. Takiyah grew up with my oldest daughter. She's a very special young lady. She's not only athletically talented, but she's extremely intelligent. She's respectful. She's determined. She probably has the most positive outlook and maybe the best attitude of maybe anybody I know. But I had the honor of coaching Takiyah when she was real young, growing up playing in our City of Charleston rec department. And, I was just a dad volunteering, and I don't take any credit for her athletic ability, but I will tell you that I had an opportunity to coach she and one other young lady, Amber Campbell, who went on to play professionally, played for Wake Forest and started at guard for 4 years. But I can tell you, those two girls made me look like maybe like Mike Krzyzewski or Pat Summitt or somebody like that, and I don't take any credit for any of that, but boy, they sure made me look good. But I do remember a day when I saw Takiyah out on the soccer fields at Ackerman Park, and Takiyah was trying out, I think, for Charleston United Soccer Club, but she was probably about 12 years old. And I waited for that to get over with, and I said, "What the heck are you doing out here, Takiyah?" She said, "Well, the West Ashley soccer coach said I could be a pretty good soccer player." And I said, you know, Takiyah, you're going to be good or great at anything you do, but please tell me you'll never put down that basketball. So I'm happy that's the case and that she hasn't done that. And I do want to say to our recreation department, to Lori Yarborough and Robin Cooper, you know, thank you for what you do. Takiyah is just one example of how we get kids started, you know, down the path to success. And Takiyah, as a matter of fact, you can still see her using our city gyms, particularly Bees Landing Recreation Facility in the off season. She goes out there, shoots the ball a little bit, and every once in a while, there's some guys that want to take her and she'll show them what a real basketball player is out there at Bees Landing. So Takiyah is just getting started with a professional career, but she was, after playing 4 years for Baylor, and a lot of people know the history of Baylor women's basketball, outstanding, second to none. Although I would have liked to see her play for Coach Staley, but she did a great job at Baylor, and I wouldn't wish anything different for her. But since she entered playing professionally, she went to Spain first, and she was leading scorer in the league in Spain, and now has been named the Import Player of the Year, the Freshman of the Year, and the overall most valuable player of the year in her professional league in Turkey. And again, she's just getting started to play professionally, and it's going to be a blast to watch Takiyah as she advances over the next few years. So congratulations, Takiyah. I'm excited that it's going to be Takiyah Cohen Day in the city of Charleston. So congratulations.
Thank you.
So Takiyah, if I may, I have a proclamation for you that I will send to you. And frankly, much of what's in the proclamation, Councilmember Shealy just relayed to us all just because he knows your story so well. But needless to say, she was a standout player at West Ashley High School. She graduated in 2014. She earned all-state volleyball and basketball recognition, received South Carolina Player of the Year. She was a standout member at Baylor University of the women's basketball team. And it says how many times they went to the Big 8, Big 12 champions, Elite 8 appearances. I mean, they were just incredible. After her graduation, as mentioned, she played professional basketball in Spain, and she's now in Turkey. So whereas the city would like to congratulate you, Takiyah, on your successful basketball career, thank you for your ongoing leadership and service to the Charleston community. Your professional career has only just begun. We look forward to many successful seasons in the future. So therefore, I, John J. Tecklenburg, Mayor of the City of Charleston, in honor of you, do proclaim Tuesday, July 14th here in Charleston as Takiyah Cohen Day. So.
Thank you so much.
And the floor is yours, young lady, if you'd like to make a few remarks.
Yes, thank you so much. This means everything to me. You know, I love the city. Whenever I'm playing, I think about that a lot, like coming home and just making everyone proud. So just to have my own day is really an honor. Like, I couldn't imagine anything like this. So I'm just glad that basketball took me to places I could never imagine. You know, I just try to stay focused and do whatever I can, and it's paying off, I guess. So I really appreciate this. Thank you so much.
Well, God bless you.
Thank you.
Congratulations, and we know you've got a bright future ahead of you. You've already seen that. Thank you, Takiyah.
Thank you.
So next we have, again from Councilmember Shealy, a proclamation regarding National Collector Car Appreciation Day. I'll read this first, Councilmember Shealy, and then ask for your remarks. So whereas for more than 100 years, the history of the automobile has impacted economic progress in the city of Charleston, recognizes the activities involved in the restoration and exhibition of classic automobiles. And whereas the collection, restoration, preservation of automobiles is an activity shared across generations and across all segments of society through thousands of car clubs and related businesses. Whereas automotive restoration provides well-paying, high-skilled jobs for citizens, whereas automobiles have provided the inspiration for music, photography, cinema, fashion, and other artistic pursuits. Whereas I encourage the citizens of our community to engage in the events and commemorations of Collector Day Appreciation Day, Collector Car Appreciation Day, that creates opportunities for collector car owners to educate young people about the importance of preserving the cultural heritage of the United States, including the collection and restoration, preservation of collector cars. Therefore, I, John J. Tecklenburg, Mayor of the City of Charleston, do proclaim this coming Saturday, or last Saturday, as National Collector Car Appreciation Day in Charleston. Councilmember Shealy, do you want to add any remarks?
Yeah, thank you, Mr. Mayor. You know, for the last 3 years, I've had an opportunity to be part of the National Collector Car Appreciation Day in Charleston. It's the 11th year that they've celebrated this, but for the last 10 years in a row, they've driven their cars kind of like in a parade fashion through the city of Charleston, actually out through West Ashley, ended up over at Magnolia Gardens. They did a little bit of an abbreviated part of that this past Saturday, but Sergeant Trevor Sheeler, who was with our police department, has been heading this up. He grew up in West Ashley. He's now retired from our police department, but he also serves as a reserve police officer for us. And he's just done an amazing job of organizing that parade, you know, through Charleston and the surrounding areas. And like I said, this past Saturday, he had it very organized. They were very careful with their social distancing and doing what they needed to do there to stay safe. And I just want to thank them for their efforts. And I'm so happy we're able to continue to do this. And just want to say thank you for the effort into caring for and restoring these cars for all of us to enjoy. Hugh Hyatt's another one that works along with Trevor. It makes this great group possible. So I just appreciate them allowing me to be a part of it. And if you really want to see a great video, if you go to YouTube and search Car Collector Appreciation Day Charleston, there's different ones from different years. I think the 2018 is a great video to see if you want to take a look at it. But I just thank them for all their work. I don't know if Trevor's on the meeting or not, but
Trevor, are you out there?
His efforts.
I'm not sure.
I don't think he's on the call.
Okay. Well, thank you again, Councilmember Shealy. That's a great effort.
Thank you.
Very briefly, I just wanted to recognize, given the fact that we enjoy a sister relationship with a city in France, which is Flair, France, and I sent today a letter of congratulations to the mayor there on a happy Bastille Day. And I see that Councilmember Shade is in the spirit. You might notice the fireworks, and it almost looks like an oil derrick, but that's actually the Eiffel Tower there that the fireworks are exploding around. So we're definitely in the spirit, and we've communicated our good wishes to our sister city in France, and I'll let y'all know if we hear back from him this week. I'm sure we will. And then lastly, I'm kind of adding this to the agenda with y'all's forbearance, that it came to my attention that this coming next Tuesday is the 80th birthday of Congressman James Clyburn. He'll be 80 years old, and I have this really long proclamation that I'm not going to read the whole thing because many of you know of his many accomplishments, but they are many, and that's why it's on a longer piece of paper, because it takes that to get them on there. But I will send this to Congressman Clyburn in honor of his 80th birthday. Next Tuesday, July 21st, on his birthday, we also proclaim that to be Jim Clyburn Day in the city of Charleston. Happy 80th birthday, Congressman Clyburn. So, and by the way, he's helping us on all kinds of issues, including finding extra funding for the Earhart extension of the Spring Fishburne drainage project. His staff is working very hard on that for us right now. He's been instrumental in including local governments in this latest version of the CARES Act. And we've been getting his office the information about our budget shortfall. So he's been helping the city of Charleston there. So, which is nothing unusual. Congressman Clyburn has been helping the city of Charleston throughout his congressional career. So without further ado, we'll move next to the approval of city council minutes from June 23rd.
So moved.
Second.
Any corrections, deletions, additions? Hearing none, all in favor, please say aye.
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 Any opposed? The ayes have it. And next we have our citizens participation period. Madam Clerk?
Yes, Mayor. What we're going to do today is we have a number of people who were on the list and left comments. And so we'll start with that list. It's pretty comprehensive, but what we're going to do is we put them in categories. The first would be those persons who left comments that they oppose the mask ordinance. That was 12 people. Then 109 people support the mask ordinance. One person would like to limit the number of people who gather for weddings. Another person, or two people, would like the postponement of public schools. One person would like public schools to reopen. 20 people were disappointed in the John C. Calhoun statue removal. 111 persons support the statue being removed, the John C. Calhoun statue removal. 13 people support the development of Ghost Island. One person opposes Ghost Island development. 7 people think that we should have a shutdown in the city. One person is asking for you to allow mail-in ballots for the election. Another person is interested in doing business with the city in regards to street corner shopping. A gentleman is interested in purchasing the statue for preservation in Tennessee, and I suppose that's the John C. Calhoun statue. That was one person out of Tennessee. And 7 people oppose tax money being used for further removal of Calhoun statue columns. Finally, one person wanted to express her support for increased citywide restrictions to protect against COVID-19 spread. Now that is from the comment section.
And Vanessa, this is Jennifer. I was just going to add all of the comments received by phone and online were sent to council in advance of the meeting.
Okay. Okay. And we also had 10 people, we have the opportunity for people to sign up and leave comments. So we have 10 people who did that, who would normally speak. So I don't know how you want to handle this, Mayor, with the timing. We do have 10 people who would like to speak. So I'll call them by name. Do you have a particular amount of time?
So we got 10 folks signed up.
10 people have signed up.
Yeah.
2 minutes.
Takes a little time. Let's say 90 seconds per person.
90 seconds.
A minute and a half, right?
Okay. So the first person would be Ken Snyder, followed by Chris Swain. You have 90 seconds, Mr. Snyder.
So we're going to actually go to Mr. Swain. Mr. Snyder is not on the call.
Oh, okay. So you're breaking up a little bit. So Mr. Snyder's not on the call?
Correct.
Okay. So, all right, Chris Swain.
Mr. Swain is up.
Hi, this is Dr. Swain. Thank you for having me. I'm going to defer my time to my attorney, Trenum Walker, and then if there's any time afterwards, I can be happy to speak then if you have any questions for me regarding Ghost Island. Trenum is signed up to speak also, by the way.
All right.
Okay. Next is Miss Pringle Franklin.
Yes. Can you hear me?
Yes, I can.
Yes, ma'am.
Oh, good. Well, last time I spoke to you, city council members, and I do want to congratulate you for getting the Calhoun statue down so quickly. I mean, it didn't seem quick but anyway, you did it. Congratulations. And then I understand now that you are contracting with the Turner Construction Company to take down the column. Of course, I want to say I wish the column could stay in Marion Square and could have some unifying symbol put on top of it. But if that can't happen and if it has to be removed, I hope that the city recognizes that it is an important relic and that you are planning to save the column and hopefully repurpose it for a future date. And the last point I want to make is that all across the country, all kinds of crazies are coming out of the woodwork, and they're just lambasting American culture and American heritage and fighting against Columbus and Lincoln, and even an elk statue in Portland, Oregon has been attacked. So let's please protect our culture, our American heritage in Charleston. I approve of what's happened with Senator Calhoun coming down. That's a completely different ballpark than our founding fathers and these symbols that should be unifying to us all. Thank you.
Thank you, ma'am.
Okay. Next is Courtney Burks, followed by Diane Hamilton.
And we're going to go straight to Diane Hamilton because Courtney Burks, the phone number is not on the call.
All right.
Okay. Diane Hamilton.
Good evening, Mayor Tecklenburg and the members of City Council. I'm Diane Hamilton speaking on behalf of the Maryville-Asheville Neighborhood Association. We are asking for your support for a request final review to the South Carolina Board of Health and Environmental Control in relation to their having issued a permit to Dominion Energy to conduct a directional bore from Mamie Street to Ghost Island. Our reasons were outlined in the letter sent to you earlier today. Pollution and/or contamination of Old Town Creek and the quality of life of neighborhoods adjacent to the island, as well as protection for burial places, are our top priorities. We also want to thank our councilmen, Waring, Shade, and Saccharin for working with the association on this issue. Thank you for listening.
Thank you, ma'am.
Okay. Next, Trenum Walker.
Thank you very much, Mr. Mayor, members of council. Trenum Walker, 66 Hazel Street. As Dr. Swain said, I represent him and Debbie with respect to Ghost Island. I sent a letter to all the council earlier today that outlines the many reasons we would submit that the city should not be involved in the appeal of the Dominion permit to do the directional bore. As I said in the letter, Dr. and Mrs. Swain purchased the island. They've removed two barges of trash, cleaned it up, planned to make almost all of the island a garden. They're also going to protect and honor the remnants of the former above-ground tomb, something that has never been done, a tomb that has been vandalized for over 100 years. They would also like to build one day a small cottage. For these actions, they've been vilified on social media, attacked as insensitive. They've watched as government officials and the media have been bombarded with misinformation, which I addressed in my letter, all in an effort to work up a frenzy against them. Once more, they find out on the eve of a council meeting, just as happened last December, that council is going to discuss their property, including ways that some want to throw up roadblocks to keep them from doing what we submit is the preservation of this island, not its desecration. The Swains have been fully cooperating with city zoning, city building department, city fire marshal, and other city personnel since last December to make sure the I's are dotted and the T's are crossed. If this council has concerns about what the Swains are doing and wants to know more, we suggest the better course is to sit down with the Swains rather than contesting Dominion's permit to provide electricity to their property, or figuring out rather than trying to figure out ways to downzone or to deny city permits before they've been applied for. We'd ask, let's collaborate, not litigate. Thank you.
Okay, that included a little bit of the time that was asked. That was 2:17.
Thank you,
Okay.
Ms. Wall.
All right. Gus Smythe?
Hello, Mr. Mayor. Hello, members of council. Thank you very much for hearing us. Can you hear me?
Yes, sir. Welcome.
Thank you. I am calling on behalf of Chris Swain, and of course, Barrister Trenum there is much more eloquent than I, but I would like to say it's confusing for a lot of people who are trying to understand the issue on Ghost Island, why the city is deciding who can and can't have electricity, and why they would try to block a citizen, a tax-paying citizen, from getting electricity to their property. And that mystery has yet to be solved. Apparently, according to the lady from Maryville, there are 3 members of council who are involved with trying to get this done. But as far as we can see, as far as citizens of Charleston, there was a garbage dump that is now trying, that the Swains are very, very hard trying to turn it into a botanical garden, and they're being stopped. And the question out there is why? Thank you for your time.
Thank you, sir.
Okay, thank you. The next person.
Madam Clerk,
Yes.
Mr. Schneider supposedly is on the line. I guess he's on mute. It's an 847 number. I don't know if Tracy can unmute him or not.
Okay.
I'll certainly look for him. I'll look again, but the number that he signed up with isn't on. It looks like he might be signing on now. So we'll add him at the end if that's okay.
Okay, so we'll now have Rory Wojcik. Is Rory?
Thank you, Mayor. Thank you, Mayor and members of the council. I've addressed the council prior about Mary Murray Drive. And today I want to talk about King Street. Creating a safe environment for the public is as important as ever, but choosing or making decisions based on one piece of information is never going to be good. And I expect and understand that all of you are making decisions based on a plethora of information coming in. Increased guidelines and ordinances to protect residents and tourists need to be enforceable. And of course, some merchants and business owners will balk at them. Enforcing capacity rules for establishments will help limit the COVID spread, and a direct response to this public safety effort is severely limiting the ability for locally owned establishments to turn a profit. You create one rule and there's an effect afterwards. A solution to this problem is creating parklets along King Street to increase public space and also incentivizing the public to walk and be less reliant on the use of cars. They support local businesses. They create a sense of place in neighborhoods and also benefit by allowing more space for patrons of these locally owned businesses along this corridor. I suggest that a 2 parklet per block space rule be enacted to allow and to support locally owned businesses along that area.
Time.
Thank you so much.
Okay, next is Billy Saunders.
Can you hear me?
Yes, sir. Welcome.
Okay, I'll make this quick. I'm kind of confused as to what's going on with Ghost Island. I've been by that several times, and it's nothing but becoming a beautiful thing. And from Charlestown Landing, I would think they would rather have a beautiful botanical garden to look at than a trash dump. The second thing is, from what I understand, Mr. Swain has some property. The property is all zoned as residential, and why would the city zone it as residential and now say that he can't build on it? That's got me confused. Why he can't build a little single cottage and the city would try to restrict it. I'd like those questions answered. Thank you very much.
Thank you, sir.
Thank you. The final person is Bethany Nimitz or Nimitz. Bethany Nimitz.
Hi, Mayor and Council. I am Bethany Nimitz. I'm a longtime resident of the Peninsula. I've got 3 kids, and I'm the wife of a small business owner. several businesses in the hospitality industry. Obviously, we've experienced the negative financial impact of the first shutdown. We've gone through homeschooling and the challenges of reopening businesses safely. We've had employees infected with COVID-19 and tried to offer guidance and support and contact tracing of any exposures. We have seen firsthand the general unwillingness of Charleston's visitors and occasionally citizens to embrace mask wearing and social distancing. And we continue to see a steep decline in income as South Carolina and Charleston dominate national news as a new epicenter of the outbreak. In the midst of all this, we watch as our federal, state, and now local officials continue to do too little, too late to manage this. Our friends in healthcare share this dismay, and they wonder why they've been left out to dry when they're risking their lives to save ours. We know we have a nursing shortage. We know new cases continue to climb. What I want to say is that the proposed ordinance that you're voting on tonight is, again, too little, too late. We know from science that indoor gatherings are extremely risky, and we need to close all indoor bars and indoor dining, as well as gyms and other indoor gathering spaces at this time. Our long-term economic recovery hinges on your willingness to act wisely and forcefully now.
Thank you, ma'am.
Mayor, that concludes our list. But
Mr. Snyder is on board, though.
Okay.
Correct.
Hello.
Yes, sir. Mr. Snyder, please proceed.
Hi, I just wanted to say, first of all, that a municipality in the financial world is viewed the same way as a C-suite or the boardroom. And when investors lose confidence in that C-suite boardroom, council members and mayor, they take their investment and they flee. So we're starting to see that on King Street. On May 30th, the city completely left us to fend for themselves. And now, I don't know if y'all been out there, it looks like the 1990s, and it doesn't feel safe to myself or just about anybody else there. So the question is, barring COVID and everything else, what is really being done to address the safety issues that are going on King Street? And if y'all don't know what's going on there, you have to communicate with the police department, because there are issues every single day. And one day someone's going to go back to New York or Chicago, and they're going to post something about Charleston, and the straw is going to break the camel's back. So that's my question.
Thank you, sir. Appreciate that. Appreciate everyone's comments and for being with us, and all the emails and phone messages as well. Apparently there were hundreds of those, and we appreciate everyone's input. So next we'll go to our petitions and communications. First up is my recommendations on the appointment of 2 municipal court judges. And I'm not sure if they're with us this evening on Zoom. I think they were invited. First up is Lindsay Bird, who's been a prosecutor in the municipal court for some time now. She knows our court inside and out. And oh, by the way, I also wanted to thank Chairman Shade and all the committee members of the Public Safety Committee who interviewed, I think, 19 different candidates that we had. It was really a remarkable task just for the committee to get through those interviews. And I really appreciate the time and energy and thoughtfulness that all of you put into conducting those interviews. So we could take them separately or together. My second recommendation is Emmanuel Ferguson, who's had, he's a young man, but he's had a very robust career working in the U.S. Attorney's Office, working in the solicitor's office, in private practice, really all levels of criminal prosecution. And both of these fine individuals would be a great addition, I feel, to our municipal court.
Move for approval of both candidates, Mr. Mayor.
Thank you.
Second.
Second. Any discussion? All in favor, please say aye.
Aye.
Aye. Aye.
Any opposed? The ayes have it.
Was it one nay? Did I hear a nay? Okay. was all aye.
So, Ms. Byrd, are you present?
I think there was a nay.
There was a nay.
There
That's
was
what
a nay from
Councilman
Councilman
Seeking.
speaking. Okay, thank you.
Ms. Lindsay, are you on the call by chance? I just thought I'd give you the opportunity to say hi if you are. And Emmanuel Ferguson, are you on the call? Well, apparently they didn't get signed on, but I'm sure most of you know them, and we'll be interacting with them soon.
Mayor?
Okay. Yes, sir. Councilmember Mitchell.
If they're not on the line this time, would you ask them to try to be on the line the next time at our next city council meeting?
I'll be happy to. Absolutely.
Thank you.
Yes, sir.
Mayor, this is Lindsay Byrd. I'm present on the call.
Oh, great, Lindsay. We can't see you, but we can hear you. You want to take just a minute and introduce yourself to council?
Sure, thank you. As Mayor said, my name's Lindsay Byrd. I've been the deputy prosecutor for the city for the better part of the last almost 6 years now. And before that, I was prosecuting in the Charleston County Solicitor's Office under Scarlett Wilson. And have really enjoyed my time with the city, and I'm just very grateful for your approval tonight. I want to thank the council members, Sheely, Shade, Seekings, and Saccharin for the opportunity to meet with them and for their recommendation to the mayor. So thank you all.
Thank you, Ms. Burke. Appreciate it very much. And Emmanuel Ferguson, did we miss you? Were you here? I'll ask him to come to the next meeting.
Mr. Mayor, he just sent me a text saying that he is on the call as well. I'm not sure if he's muted or not.
Okay. You want to call out his number? Maybe Tracy can find it.
I would just like to see them in person. That's about it.
Yeah.
All right, we'll do that.
Okay. So we'll see maybe later he can be in Zoom. So next is I'm going to defer this to tomorrow, maybe the next day. I will send y'all a recommendation for members of the Central Business District Improvement Commission that we will take up under bills for first reading. But I want to get them going as quickly as possible. So after we give approval here this evening, hopefully, I will follow up with y'all by email in the next day or two with some recommendations for those members. So that brings us to the city's update on COVID-19. And I'd like to start with a quick update from both Tracy McKee and Shannon Scaff. And
Mayor, can I ask a question real quick before we get on to that?
Yes, sir.
Just on the King Street thing, because I do think there's a number of people who are interested in what's going on King Street. Is this something that's going to come back to us at a next city council meeting? How are we going to deal with this?
Well, you mean the commission that we're forming tonight?
Yeah.
It'll get first reading tonight, and it is an ordinance, so it will require a second and third reading at our next meeting. But my intent was to go ahead and share with you my proposed recommendations. Actually, the way the ordinance is written, I think it's my choice to choose the members, and if y'all approve it that way, and then they would have the opportunity, understanding that they couldn't take official action until the ordinance gets second and third reading, to go ahead and meet and start to address issues that are our central business district is facing.
Okay, thanks. I just think procedure-wise, people are interested in how this is all going to go. Thank you.
Yeah. Okay, so Tracy, do you want to lead off, or Shannon? We'll start with Tracy. It looks like she's ready.
Yes, sir, I am. Good evening, everyone. Oops, turn on my video too. So I'm just going to do a quick update, and I drew the short straw again. So I think Shannon is on the line in case we have questions specifically for Shannon, but we wanted to keep it brief, but just give you guys a quick update on what's happening in the city. So just really quickly, I think we're all familiar with the prevalence of COVID, and basically all this is the total number of cases per 1,000 people. You can see, you know, Charleston, we're not getting any better. 26.1 is our prevalence of COVID positive cases compared to Charleston County, which is 19.8. And then Berkeley County is 10.9 and the state is at 11. So growth rate since Memorial Day, and the growth rate, I know I've covered this a couple of times, but this is really just about how rapid transmission is occurring in an area. So the orange line is our city's rolling 7-day growth rate. And then the blue line, the solid blue line is what's happening in the state. The red dashed line is where we get into, that basically puts us in a red status, if you will, for that particular metric. And the yellow is where we're kind of in that warning stage, if you will. You can see that we kind of dipped below the red line for a little while, but you can see after today's numbers here at the tail end of that, we're starting to see that 4th of July impact now. So what's really telling, I think, is the new cases, the new daily cases per 1,000 people. And why this is important, it's basically looking at what's manageable for our medical systems and to allow for efficient contact tracing. So again, here the city is in orange, and then the state is in blue, just for comparison. And then the red dashed line is where we're kind of really in that danger zone. So you can see that right now we just took a big upturn with today's new numbers. And our hospitals are very much feeling it. And I'm going to talk just briefly about that in a moment. But I did want to bring everybody up to speed on what's happening with city employees as well. So to date, we've been extremely lucky. 0 of our employees have been hospitalized due to COVID. Total, we've had 89 positive cases. Currently, we have 21 active cases, and we have 56 out waiting for test results. This has improved a little bit, but kind of like we started to see in the numbers today. I hope I'm wrong, but I believe we may see another uptick in this, in these numbers as we start to see the impact from the 4th of July weekend. Just for reference, when we were kind of in that last little spike, we actually at one point had over 100 employees out waiting for test results. And so, and this next graph kind of shows that. I mentioned this before, we're tracking every day our employee status, where if they're in the office or working remotely. This pink is actually sick leave being taken. So you can see we've had a big increase in the amount of sick leave. And this is a combination of folks who are either positive and home sick or waiting test results. So we talked about testing a lot. So really quickly with the hospital systems, we're hearing more and more how stressed our systems are. And with the numbers that just keep coming in every day, that's going to continue to increase. And I just want everybody to know that Shannon's staff is working very closely with our hospital systems to make sure that they get the resources that they need. And we're doing everything that we can for them to support them. Also, mobile testing. Right now, MUSC has mobile testing out on Johns Island, out at Hout Gap Middle School. MUSC has projected out the next week, maybe 2 for kind of hot spots. After that, they have not determined where their next spot will be for mobile testing, but all of that is updated on the DHEC website. I do want to also mention there are a number of other efforts being worked on around testing. Nothing finalized yet, but it is really important. And just because the volume of testing the amount of time that people are waiting for those test results is also increasing. So this is really becoming, it's not getting better. I think we all know that. It's as these cases end up in the hospital, these patients end up in the hospital, it's going to continue to get worse.
Hey, Tracy, can I ask a quick question?
Absolutely.
So there's been some confusion about whether or not folks need a doctor's permission or authorization to be tested. Can y'all comment on that one part for me, please?
Sure. Yeah, it's my understanding that that right now, if you go to these testing sites that are on the map here, that I'm not sure if you actually have to be, to my knowledge, you do not have to have symptoms, but you have to go through the telehealth and actually register and get an appointment to get tested. The mobile sites, you don't even need an appointment. You can just show up and they do the registration there on site and you get tested. That's the last, as we all know, everything changes daily, but that's the last bit of information that I have regarding our testing sites.
Thank you.
You're welcome. And that's all I had. So I'm happy to entertain any additional questions and certainly invite Shannon Scaff to jump in if he wants to add some additional tidbits for y'all.
Councilmember Sacron.
Thank you, Mayor, and thank you, Tracy, for the data. Couple quick questions. Is there a report out on where some of the additional testing sites will be? Can you give us a status on that? I've heard from a lot of small business owners that when their staff, do suspect they're positive or hear about it, it's imperative that they get tested and the turnaround time is quick. So that's number one. And then number two, just an update on where we are at the hospitals in terms of capacity. It'd be nice to hear, what their status is in terms of incoming.
So that's a nice lead in. Also on a call tonight is Dr. Chris McLean with, he's the head physician officer, chief physician officer at Roper St. Francis Healthcare System. And I've asked Dr. McLean to be with us tonight to give us a report on just that. So if I may, without further ado, I'll call on you, Dr. McLean, to give us an update.
Thank you, Mr. Mayor. Thank you, City Council, for giving me some time tonight. Roper's update. So, I represent the Roper St. Francis Healthcare with 4 hospitals in our area. And across our 4 hospitals, we have 140 inpatients. This is what it was around 2 o'clock. It's very dynamic. But 140 inpatients, that represents about a 75% capacity rate on our inpatient capacity. That's 40% of those inpatients, 140 are our capacity. But if you look at all the patients in our hospital, it's about a 75% capacity. Our ICUs have been fluctuating anywhere from 70 to 80% of capacity through the incident. And today we're right around 72%. So our biggest issue is not so much bed capacity as much as it is staffing. You alluded to the strains on the workforce in the city government, and we're not strange to that either. Our biggest issue has been nursing and provider capacity, just from the providers themselves getting affected by the illness and having to stay out of work. As has been noticed in the media and kind of mentioned before, we initially, about 2 weeks after Memorial Day, did see an influx in younger patients with the disease, and then as that spread through the community, began seeing the older patients that were requiring hospitalizations. We fully expect that to be the case after the July 4th weekend, and so are looking towards this weekend and into next week, and expecting quite a bit of surge to come. So the capacity issues we're having now, we expect to only become magnified over the course of the next 1 to 2 weeks. And so it just presses on the urgency to act now in order to try to stem the tide.
And in my report from Dr. Cole yesterday, I think they had 111 active COVID admissions in their system. And in a very similar way, he quoted the number, but it was hundreds of staff members who also are COVID active or out of work right now. So there's serious capacity situation there as well.
Yeah, we're in communication with all the hospitals of the area. And so if you calculate all of the inpatients right now that are suffering from COVID disease, it was roughly, that was around, I'd say about 300, a little over 300 for considering all the hospitals.
Well, thank you, Dr. McLean, for being with us. And I got your letter this morning, and we're responding to try to help connect you with resources, both with DHEC and with CDC. I had a conversation with them today as well.
I really appreciate that. I hope that's the case. And I just want to reemphasize, use this few more seconds just to really emphasize the severity of the situation. I know that as city council members and as the mayor, you have a lot of things on your plate and a lot of things to weigh. But the severity of this it's very critical, especially viewing what is likely coming in the next week.
Thank you. Councilmember Sackman and Seeking.
Thank you, Dr. McLean. One more question I do have is, I think folks in the public get caught up in the mortality rate versus those that are check into the hospital for long extended periods. So the concern is really the capacity at the hospital. So can you talk to me explain a bit more about the capacity and how that overwhelms versus the mortality rate? I think, folks hear about the low mortality rate and assume that, it's just like the flu. So I guess, can you explain that a bit more for us?
Sure, I'll be happy to. So there's a couple things you have to consider when you consider, well, I'll start with mortality because that's where you started. The mortality rate is variable with this disease depending on your resources to care for it. So many of the things that we use to care for this disease process are scarce resources. In other words, they easily can be overrun of our supply. When you think about the oxygen supply, the ventilator capacity, some of the critical drugs that we use that have been very successful at helping to curb the acuity of this disease are in limited supply. One of which we use in the first week of therapy is remdesivir, and it's on government allocation. So literally, we have to apply for each case that we're using. It has to be approved to be used. And so when you talk about that type of control restraints on the supply chain for the treatment of this disease, anytime you elevate the rate of incidence and the rate of admission for this disease, your ability to care for it in the best way possible is extremely limited. And if you look at what, in one day we had a 65% increase in our census, our number of COVID patients that were in the hospital in one day. And so when you start thinking about that, what we just experienced with Memorial Day and now looking forward to next week, you can easily, it doesn't take much imagination to imagine seeing all of our resources being stripped. When that occurs, then your ability to curb that mortality and keep those numbers low is significantly strained, both in a bed capacity, nursing capacity, oxygen support capacity, all the things that we use. When the other component to this illness is that some of the disease is easy to turn around and responds well to therapy and they go home. Some of them don't, and they require extremely long hospitalizations, which then occupy that bed capacity and that nursing capacity for, we've had up to 45 days in isolated cases. Now, overwhelmingly, the length of stay is not that long for these patients, but when you have even a small percentage of the patients requiring that, your ability to continue to handle elevated caseloads gets very strained. And eventually you're stuck with, caring for all those long-term patients and not having any way to offload them in order to take care of the new wave that's coming. That's what's got me most concerned about where we are currently. We had a hard enough time handling the Memorial Day surge when it occurred. If we now stack on top of that what may be coming, it's a significant burden, and it's going to be most likely a significant increase in mortality if we're not able to provide the care that we know we need to provide.
Thank you.
Councilmember Seeking.
Thank you, Mr. Mayor. Dr. McLean, thank you for spending some time with us in what I know is a busy time. I appreciate it. So obviously you all sit around and think about this a lot. And if we were to ask you, and we're going to talk about it tonight, sort of what's on your wish list, numbers 1 and 2 out here in the world that we can do to ease your burden, what would you tell us?
I think first and foremost would be masking. I think we have great evidence for that and insisting on that through our community and our retail spaces. The second would be taking a hard look at areas that we know are high risk areas for community members to be in to spread the disease. So it's at places like bars and restaurants, and taking a hard look at does it make sense to have that open right now, given what we're facing. I think another thing that we're asking for is resource management. I mean, again, if there are any opportunities to come alongside and partner with the government agencies, that we do that to mobilize staff. It is the most critical resource right now in the entire Charleston community in healthcare. And so anything we can do to move that message up the line and allocate the proper staff that we need here, we need to do that. The other thing are supplies. I know I mentioned earlier we've been working with city government, and I appreciate their help, but we can see if this surge comes that those PPE levels are going to be strained. Testing is a big issue for us, as was mentioned earlier. The testing turnaround time from some of our outside vendors has been strained. So anything we can do to allocate resources to those testing centers and encourage both our private and public providers of that testing to increase supply is critically needed.
Thank you.
Councilmember Griffin.
Councilmember Seekins pretty much covered my point. Good job, Councilmember Seekins.
All right, Councilmember Shade.
Yes, sir, Dr. McLean, thank you for your assistance and just being very direct with us, is I think what you said we need to do. When you had mentioned your resources and you talked about your medical personnel, have you experienced a high number of your personnel being affected directly with the virus, and what kind of rate that you've experienced with that?
Yes, we have. We've had a significant portion of our resources have been affected. As far as an overall rate compared to it falls in line with what you see in the community. So we haven't noticed any increase relative rate within our walls with respect to our workforce than what you see out in the community. The age just has also been pretty parallel to what we've seen in the community as well. We do extensive contact tracing on all of our teammates that have contract disease, and can say with certainty that the overwhelming majority, to the tune of 99%, appear to be community spread and not from within the healthcare arena. So I think when you add in the difficulty we have with some of our testing resources, that's something I've been very proud of as a health system, knowing that we can't test every single patient that comes in the hospital because of testing resource scarcity. The fact that we've been able to continue the safe practices that we have inside of our walls have, just kind of demonstrate that it works. And if we take that same approach of generally the masking, social distancing, and other social interventions, if we take that approach out in the community, I would expect to see similar decrease in trend.
And if I could just follow up with another question with you. So our academic school year is going to kick into high gear in about a month's time, which is going to include elementary, high school, and our colleges, which are local here. What is your concern when those events start gearing up, when we start having a large number of college-age students returning to campuses and elementary, high school, middle school students returning back to their schools?
So I think it's the similar concerns that everybody has with it. I think, anytime you have an opportunity for people to be gathering together in large gatherings, there's concern for, exponential spread. And so those would be the concerns. I would say that, with proper interventions, I think that, there are things that can be done to significantly decrease those trends. And so I think the things that we've been outlining, the distancing, the masking, hand washing, all the things that you've been considering yourselves, I think can be put in place. I think as far as my official recommendation for schools at this time, I would have to see what happens over the next 4 weeks. I think that's going to tell us as we get a little closer to the time of when it's game time to make that decision, because things could change. I mean, if we make significant social interventions, we can see this thing settle down as quickly as we saw it elevate.
Thank you so much.
Thank you, Dr. McLean. Councilmember Appel.
Thank you, Mr. Mayor, and thank you, Doctor, and everybody at Roper and MUSC and all the folks on the front lines. I've got a lot of friends and family in the medical profession, and what these guys are and girls are doing every day is just truly exceptional. And these are the real heroes today. We all know about masks. Well, at least a lot of us do, and we're pulling some other people along here, but we all know about masks. We all know about social distancing. The one thing that I don't hear about as much and wanted to get your expert opinion on is really what the message ought to be to the quote unquote vulnerable populations, the elderly, the folks with comorbidities, whether it be obesity or lung disease, heart disease, things of that nature. Do these folks need to, quarantine, essentially, stay away from, hardware stores, stay away from going to church, stay away from places where they can be exposed to people? It seems to me that this is the element of the messaging that I don't hear too much of, but from all accounts, these are the folks that actually stand the greatest likelihood of getting sick and potentially dying. That's not to say young people are immune, they certainly aren't, but would taking some more proactive measures by these vulnerable populations help in these difficult weeks and months ahead?
Yeah, I appreciate the question. I definitely think that when you talk about quarantining or limiting your exposure to possibly, getting transmission of the virus is certainly an effective measure. I can tell you all the people I know that are high risk, including my mother, I've been counseling to stay home and stay out of public spaces as much as they can. We go and get our groceries, so I'll tell you what I'm doing at home is good advice to what we give other people. So I definitely think those measures are important. I think though, if we tried to curb the severity of this incident simply by telling our at-risk people to just stay home, I think that would be short-sighted in what we can do to really make a meaningful impact. Mainly because if you have spread throughout the rest of the community, then your ability to truly isolate yourself from transmission from this gets dramatically harder. And mainly because there's only so much you can do to protect yourself. You have people delivering the mail. You have, people that have to bring you groceries. You have, there's only so much you can do to truly isolate yourself. And so as the community burden increases, then the likelihood of spread to even those people being the most careful becomes higher.
Thank you.
You muted, Mayor.
Mr. Mayor, you're muted.
Mayor, you're muted.
Sorry about that. Dr. McLean, I was just thanking you and all of your colleagues because Councilmember Appel said it well, that y'all truly are heroes in serving our community right now, and we thank you.
Well, thank you so much. I've had the opportunity to really witness heroes in action, so I appreciate that. I appreciate the time you give me tonight as well.
So if I may suggest we take these 4, 5, and 6 one item at a time. Is that okay with council? The first item would be the executive order, simply continuing the declaration of state of emergency, similar to what Governor McMaster did the other day for the whole state. Susan Herdina, are you on the line? Is there anything more to number 4 that we're asking for approval?
Mayor, this is just in council. Good afternoon. This is just a continuation of the declaration of the state of emergency. Mayor, your proclamation, which we've asked council to consent with, it runs until July 31st. This one, but it can be modified before that if you choose to do so, or extended after that. We thought July 31st was a good period because it would expire after our next city council meeting. So at the next city council meeting, we could consider whether it needed to be extended or not.
Move for approval, Mr. Mayor.
I have a motion to approve. Do I hear a second?
Second, Mr. Mayor.
Any discussion on just the state of declaration of emergency? All in favor, please say aye.
Aye. Aye.
Any opposed? The ayes have it. So next was kind of a combination of emergency ordinances. So Susan, if I may call on you to give us a summary of everything under number 5.
Yes, sir. Basically, this is consistent with what we've done previously. Also, we are extending until July 31st, several ordinances that we have already had in place and have been continuing. They're listed on page 4 of the proposed ordinance. Has to do with price gouging, meeting telephonically, temporary procedures for public hearings, allowing affordable housing units to be approved by an administrative officer, the decreasing risk of exposure to COVID-19 in retail businesses, and the stay-at-home emergency order. We also, at the request of the restaurant industry, have extended the emergency order on new or additional outdoor dining to August 31st. The other ones are extended just to July 31st, but and Meg maybe can speak to this, Meg Thompson, but we had gotten a request from the industry to extend that one longer than the other ones. So we've proposed that in this ordinance.
That's the one that gives our restaurants a little more latitude in using outdoor space, sidewalks, parking areas, etc., and to give them a little more assurance that will continue.
Yes, sir.
Councilmember Sacklin.
So if I'm understanding, this would expire July 31st?
All of them with the exception of the outdoor dining one, okay. And that one will expire on August 31st. The other ones will expire on July 31st, but you can consider them for an extension at the next city council meeting if you'd like to do that.
Okay, thank you.
So, and just to explain, Councilmember Sacklin, I personally would be fine giving the restaurants even a longer period of time, but since this is an emergency ordinance, we're only allowed for 60-day windows, but we can always extend it some more. So could I entertain a
Mr. Mayor, I move for approval. Item
number 5 and all those combination of emergency ordinances. Any discussion on any of those? Hearing none, all in favor, please say aye.
Aye.
Any opposed? The ayes have it.
Mayor, who was the second? Who was the second?
What's that?
Who seconded the motion?
Mitchell.
Okay, thank you.
All right. So next up is an emergency ordinance requiring persons to wear face coverings or masks in certain circumstances in our city. Actually, we passed this already, but we've made some significant amendments and changes to it. And so if I could call on Susan one more time, maybe to summarize those new things in this ordinance.
Yes, sir. So hopefully everyone received a copy of this ordinance, amended ordinance, when we sent it out under separate cover yesterday afternoon. And basically the changes are highlighted in bold and underlined. And the most significant things are the limiting the capacity, indoor capacity in bars and restaurants to 50% of their occupancy, or a square footage calculation if for some reason the business is not aware of their occupancy limit. So there's an alternative calculation here that's been recommended by the fire marshal. And again, these are just for the period of the emergency ordinance, which we basically said would be in effect, could be in effect for as long as 60 days, but could be terminated before that. So first major change is limiting the capacity in the bars and restaurants to 50%. This is only indoor dining. It doesn't apply to outdoor. The second major change is prohibiting amplified music in bars and restaurants after 9 p.m. This would apply to both music that's played outdoors as well as indoors. And the rationale behind that, Folly Beach did something similar to this a couple of weeks ago. And the rationale is two things. One, the consensus is that the amplified music attracts crowds, for one thing, which we're trying to get away from as much as possible. And the second thing is basically, if you're in a situation where there's amplified music, you're shouting over that music, which means there's a greater risk of you spreading the virus rather than if you were speaking in a normal tone. So the idea is that by limiting the capacity in the bars and the restaurants, as well as prohibiting the amplified music after 9 p.m., you are really going to see a decrease in the gathering of the crowds in the bars and restaurants, which I think we've heard over and over again from the medical community are some of the big sources of the problem here. We did some clarification on the masks. There were some questions about, did it apply on the streets and the sidewalks and in public spaces? And the answer is yes, it does, as well as inside public spaces, public restaurants, all retail spaces, big box stores. And the important thing, though, with regards to that is we are not asking the employers to force customers to wear masks. We ask them to, we require that they make their employees wear masks. We're not forcing them to have customers wear masks. However, what the ordinance does say is that if a customer walks in and they're not wearing a mask, they should be warned about our ordinance, advised of the ordinance, provided a copy, and after that point, the retailer or the business can refuse service to that person. Now, and Mayor, I know you can speak to this point. We were on a telephone call yesterday with a number of other mayors, and one of the communities said, in this kind of a situation, you know, the owner should ask for help, you know, from public service, from the police or livability, rather than they themselves getting into a tussle with their customer or prospective customer. They should seek the help of the police department to come in and help diffuse that situation. However, while we're not expecting the employers to enforce the mask rule for their customers, we are expecting them to abide by the occupancy level in the reduced occupancy level in this ordinance, as well as the amplified music restriction. And they can be subject to violating this ordinance if they fail to abide by those two parts of this ordinance. Other key factors are we've stepped up the enforcement in the sense that in addition to having our livability officers out there, we are asking the fire marshals, building inspectors, as well as the police department to be available to enforce the ordinance, which we think is important. And we have also, with respect to the masks, and I apologize, I'm sort of going all over the place, but basically going back to the masks, we're increasing the fines if you are found to be in violation of the mask ordinance, increasing the fines from $50 to $100 for the first offense, $200 for the second, and $500 for the third. But again, I want to emphasize that the idea here is to educate and to warn and to work with people, you know, not necessarily be issuing citations. So I think, Mayor, maybe, hopefully I've covered everything. The idea is that this would go into effect on the 15th, tomorrow, at 9 o'clock, and to give the businesses a little bit of time to adjust to this.
Well, the requirement is already there for businesses to have their employees wear masks. So,
Yes.
so that's not, it's not a whole lot new in a way. It's basically toughening this up, increasing the penalties, adding more accountability. Yes, we're still relying on education and compliance, but we do have some more enforcement. And in addition to what the governor did effective last Saturday of prohibiting alcohol consumption or service in bars and restaurants after 11 o'clock, we think that this is the best practices for trying to flatten the curve, shy of closing businesses again. That's one thing I think we all agree for our economy. We don't want to get back to closing down businesses. You've heard from Dr. McLean tonight and all the numbers. If we aren't successful in flattening the curve again, it's inevitable to me and to many people I talk to that that's where we will head if we get to the point where our healthcare system truly is overwhelmed. And let me go on to say that you've all heard the reports just yesterday in the New York Times. The Charleston metro area was designated one of the top 10 worst metro areas in the country in terms of the growth of COVID-19. Washington Post had an editorial last Friday advising people not to come to South Carolina. Commonly over the last week, we've seen that the whole state is third or fourth in the whole world in terms of the rate of increase of COVID-19. Just today, the state had its second highest number, and unfortunately, again, leading the pack was Charleston County. We now enjoy the dubious distinction of the highest number of cases in the state of South Carolina. And today was a record for us at 412 cases. You add Berkeley and Dorchester, there were over 600 new cases in the Charleston metro area just reported today. So the numbers are going in the wrong direction. This is exactly where we did not want to be, but we are here. So I believe that short of shutting things down again, that this is our best effort to try to flatten the curve and make a difference and see if we can we must get this thing under control. Councilmember Gregory, Saccharin, and Griffin, and Jackson. Gregory.
Yeah, maybe I missed it, but doesn't the ordinance also has penalties for businesses that don't conform and their licenses can be revoked?
Yes, sir. So basically, we do have the authority to, under state law, if a business is not complying with ordinances, to suspend their license. There is a process that you have to engage in to do that, involving a hearing and before the license committee. And so there are a number of procedural steps that have to be taken, but we do have the authority, ultimate authority to do that. We also have added into the ordinance the fact that if there are a certain number of violations against the business, either owner or management, they could be deemed to be a public nuisance if they are found to have been in violation of the ordinance. And then that too could subject them to the process of having their business license suspended. Again, this is something that the city would not do lightly. And there are procedural steps in place to safeguard businesses in that respect. But at the end of the day, this council does have the authority to do that, and is one of the serious measures that we're proposing in the ordinance.
Thanks for that answer.
Councilmember Saccharin.
Thank you, Mayor. Mr. Dina, can you clarify and maybe elaborate on the live music piece as part of the ordinance so we can get some clarity for business owners? I guess the question is it just live music, or could restaurants still be playing sound through their house sound system?
Yeah, it's amplified music in bars and restaurants. And And I guess I'll defer to the mayor to explain what that exactly means. But I guess if it's a guitar, you know, someone with a guitar sitting on a stool and it's not using an amplifier, that is not illegal. Again, we're talking bars and restaurants who've got speakers hooked up to the music. And that is what we're trying to address. Again, so that people are forced, in order to talk, they have to speak over that loud amplified sound. You know, Mayor, do you have a better explanation for that?
Well, the intent is to just address loud music, either live or recorded. So a DJ, you know, who's blasting out sounds would be applicable as well, or a karaoke event, something like that. You know, if you're in an elevator and there's like background music, I doubt that anybody has to like overly express themselves to speak over something like that. That wasn't the intent of what we're saying here, but loud music where people have to start shouting to express themselves.
Thank you.
Councilmember Griffin?
Yes, sir. So my first point is, I think that we need to either A, shut this city down completely, the bars and restaurants especially, or I know this is going to sound a little harsh maybe, we got to learn to live with this thing, because what we're doing in this ordinance is we're making a certain group of businesses, it's almost impossible for them to operate and be able to pay their staff and take the losses that they're going to take. Number one, 9 o'clock is, you know, I don't see how we can come up with these times, you know, 9 o'clock, 11 o'clock. We don't have any data to support it. It's just a meritless time. I can understand that we've got to do more. But to me, the only thing that makes sense to me is to either shut everything down or we just got to live with this thing the way it is. Because this model that we've created with these regulations, these new rules, putting the burden back on the business, increasing the fines when, to my knowledge, we haven't written one ticket so far. So how can we already increase the fine exponentially when we haven't even enforced a mask ban that we put in place 2 weeks ago? You know, another point that I look every day at the numbers. We've been wearing masks for 2 weeks. Why haven't the numbers gone down? Why are they still going up the way that they are? Is it because we're not doing a good job enforcing it? If that's the reason, you know, we should be looking at ourselves. I don't understand why we need to go from 50 up to 100, 200, 500 when we haven't written one ticket yet. You know, it doesn't make sense to me. We should be passing out masks to those that are underprivileged and that need help, because the same people that are going to be getting tickets if this are enforced are the same people that are not going to have the accessible resources to get masks. We should do a better job as a city, making sure that neighborhoods that need masks get them. I don't think we're doing a good enough job there. And at the end of the day, you know, this could go on for a long time, but you know, common sense tells me that, yeah, you look at when the numbers started to spike, you know, there's really a couple of instances. Number one was after George Floyd died and there was protests around the country, a lot of numbers spiked then. We allowed gatherings of up to 3,000 people with no permit. And you can't tell me that those large gatherings didn't increase to some of the numbers. The other instance is Memorial Day. The numbers across the South rose exponentially after Memorial Day. You wonder why South Carolina rose so much. I mean, yes, we can say that we opened up too fast, but you got to kind of look at our procedure in all of this. Number one, I would expect people from the other parts of the country to travel to Charleston during the summertime. I would expect people from around the country to travel to Charleston during holiday weekends. Is there a chance that that travel from other parts of the country could have contributed to our rise in cases? Maybe that's a question that we need to be looking at more. I know the director of the CDC made that comment today, that people traveling from all around, especially the Northeast, came down south for Memorial Day weekend, and there's a very good chance it could have spiked our numbers. So I would like to see the number of cases from out of state and who have spent time in our hospitals down here. But my other point is, you know, we have to look at where we're going with this. And I don't see our businesses surviving on this business model. They're already hurting as it is. I don't see us becoming this military type city where, you know, we've got officers and livability officers lined up and down the street, you know, questioning people and writing big fines. I mean, I don't think we want to scare people away from going out. However, we closed down first. We were one of the first to close down in the state. South Carolina closed down very quickly. And then we opened up pretty much full blast. We should have probably looked at some of these ideas before we shut down completely to see if they would make a difference. And now we're trying these procedures on the back end. And obviously this new ordinance or this amendment is ridiculously tougher than the one from 2 weeks ago. It has a lot more implications. So I guess we're admitting that just wearing the mask isn't enough, or the original ordinance that we created wasn't enough. And I can understand that because the number of cases is still rising exponentially every single day. But I guess my question is, what if this doesn't work? What's the next step? What are we going to do next? I mean, we don't really have any more options besides closing everything down once we go past this point. So I think we should just skip this part and go straight to the closure. Either close everything down, or we just need to live with it and do the best we can, because I don't think this is going to work. I don't think that just wearing the mask that we voted on 2 weeks ago, it obviously hasn't made that big of a difference. If it had, then we wouldn't be voting on this tonight. So I'm very conflicted with all of this, guys, but I think we either need to close everything down or we need to keep everything open. Thank you.
Well, thank you, Councilmember Griffin. You raised a lot of points there, and rather than responding to a lot of them, I'm going to just keep going around the council members. But some very good points. I mean, and I'll just refer to one. You know, that back in March when the CDC came out with recommendations about how opening up ought to occur, that you wait 2 weeks and follow your numbers, and then wait 2 weeks and follow your numbers. I'm sorry, but everybody from the national government to the state government basically threw that out the window and didn't go by it. To my knowledge, the best organization, or the organization who's followed that kind of protocol the closest, is in fact us, the city of Charleston. We have that kind of measured reopening. We still haven't opened our city offices yet, other than the permit center, for that reason alone, because our numbers have never qualified us to move to the next step. And so you make some good points, but I'm going to keep going around and hear from other council members. I had seen Jackson, then Mitchell, and then back to Gregory. Councilmember Jackson.
Yes, I agree, Mayor. Thank you, Councilmember Griffin. I do think you gave us a lot of good points and food for thought. I too wish that we had been more strict earlier on. We've gotten ourselves in a place where it's going to be very hard to improve radically in the 4 to 5 weeks that we're hoping our community will have success so that our children can go back to school. I think that is a huge goal for the majority of the community. That is going to define normal work life for a lot of parents. And obviously, the health and well-being of our kids, who I do believe what, you know, the Pediatric Association has tried to make clear, that kids are holistic human beings and they need to be together in their growing up years that define how they deal in a community. So keeping kids isolated is just, you know, it's an act against normal human nature. I think that this is probably the best that we can do for right now. I would like to ask the mayor to convene a group of business owners who primarily have entertainment as the core of their business model. A lot of bars play music, but they don't need to have music after 9 o'clock in order for people to continue to hang out and be with their, you know, companions until they can't drink any longer at 11 o'clock. Then that will probably, you know, send people home. I'm sure it has already the last week. But I think we have a handful. I don't know how many are actually in the city. The only one that I know well is the Poorhouse. And I know that there are other establishments, Upper Meeting, that thrive on having live music, and that is what draws their audience. So I do hope that we can convene a group like that and see what we can do to support their loss of income. We can still help them get some sort of, you know, small business loans or other things that would really keep them going if they want to be open up until 9 o'clock or up until 11. But they don't get the audience because of the failure to have live music on site. My biggest takeaway from what you said, Councilmember Griffin, is something I agree with wholeheartedly. We did not enforce the mask ordinance that we put into place 2 weeks ago. We had 15 people going around how many square miles of city neighborhoods. Obviously, they mostly stayed on the peninsula. That was what they had to do based on volume of mask wearing violations. But it was an impossible task that we gave our livability officers. And so now that we're going to throw the full force of our ability to enforce with all of our public safety personnel, I think we're giving ourselves a fighting chance. I don't know if I really care if we increase the fines. I agree with you. We probably should just start giving out fines and let people realize that you know, is going to happen to them. If they walk down the sidewalk with their mask hanging off their ear, that doesn't count. They need to have it on. That's our whole point. So I do think that we have to give ourselves a chance of enforcing to the full extent of our capacity. We have not done that. So those two things. And then the other thing you said that I really resonate with is those same enforcement officers should carry masks with them. We should make every effort to get masks into the neighborhood faith communities and the other places where people are, you know, still being helped with food deliveries and things like that. And make sure that everybody has access to a face covering that's going to sustain them. A little one use ones are not enough. We need to find masks that can, you know, be washed and literally be part of someone's going out of the house, put it in your pocket, don't leave the house without it, just like you do your driver's license. So I'm going to vote for this. The one detail that I was hoping we could maybe make it an explanation under section 6, where it says the alternative way of deciding the maximum number of occupants inside is to measure 36 square feet. I think we should define 36 square feet of what space. I'm assuming we mean dining room and where the customers are actually going to be. But I do think we should make that clear in case some restaurant owners think that they should be counting the kitchen and the bathrooms and all the places where people wouldn't really be, having any customer service. So that would be my only edit to the document. Thank you very much.
Thank you. That recommendation came from the fire marshal. And you're right. I mean, part of what we're doing here is to increase our ability to enforce. I will say that thousands of masks have been given to us, and we bought thousands, and many people are giving them out. I got a shipment of some thousands of masks from the Bloomberg organization. We were giving them out on Johns Island this past weekend. Some of you went with me up and down King Street Friday night. Almost every restaurant and bar and store had free masks available. So there are masks around, and I was going up and down the street offering free masks to just people walking by. And you wouldn't believe how many people responded saying, "Oh, I have a mask. It's in my pocket." And I'm like, okay, what good is it doing you in your pocket? You got to wear the dang thing. So anyway, that was one of my experiences. Councilmember Mitchell. You're on mute still.
I understand and agree with most of what my colleagues were saying, but even on King Street, I missed the walk the other day because I had another meeting I was in. But on King Street, where I live, and I drive on Friday and Saturdays, even on Thursdays. And if you'll see the people out there with no mask on, they have the mask in their pocket, but they will not wear it. The young people will not wear it, and they said no one can tell them to wear it. I'm telling you facts that I be out there, even in these little convenience stores, like even where Councilman Lewis is right now. People come into the store and they say, well, they can't serve you. We can't serve you if you don't have a mask on. They want to fight. No one can make me wear this mask if I don't want to. 3 different times he was approached that way. In food line, went to food line one day. The same thing happened to food line, but they have a sign on there. They will not let you in the store if you don't have a mask on. So now we in the city of Charleston are trying to be proactive and trying to do things as simple and easy as we can and not trying to hurt anyone. So we are taking step by step by step. And that's what we're doing in the city of Charleston, not gangbanging them. Sure, we can shut the whole city down. Oh yes, we can do that. That's one thing that can happen. But we are still trying to give the businesses some chance to still operate. And it's asking them in their business to say, with person coming in there, wear a mask, come in with a mask on. They do not wear masks. The younger people are not wearing it. I'm telling you, my daughter, my grand right now, she works in Walmart. They try to attack her in Walmart because she asked them to put a mask on, right in Walmart. And she works there. She was working there a long time, right there. And I have another grand working the Tanger Outlet Walmart, one working Mount Pleasant Walmart. So the same thing is happening. The people have the mask in their pocket, but they will not wear it. They don't want to wear it. They said no one can tell them, you're taking my constitutional right. And that's what they're telling them. So we're here trying to be a little proactive and trying to give people a chance to still operate, to try to do a little something to defend for their family and stop just bringing everything down on them. But the fines that we're putting in, we are putting in the fines, and maybe you look at the fine and say, well, look, I'm not going to get a fine in my business, so I'm going to do this, I'm going to do that. It's just a deterrent that we are trying. We don't want to try to tax everyone, not here in the city of Charleston. That's the way I believe that's what we are doing. So we are trying to ease things in. And I hope people understand that, and they should see that, because we can do a whole lot of things with ordinance, but we're not doing it. We're trying to ease everything in and hope that people will abide by the ordinance and abide by what we are trying to do, and that the business will still operate with certain things. And that's all we're doing here. And that's what I believe we're doing here by being out there all the time. I'm out here, they'll tell you, I'm out here 1 or 2 o'clock in the morning, every night, because of the district I have. And that's what I am. And I see things, and I'm out there standing and talking. But I keep my mask on too. I'm wearing it. And I'm around everyone. And the people I be around, half my council member don't want to be around. And I'm going to say that wholeheartedly. They're not going to stand out there with them. But I'm there because that's the only way you're going to make a difference, and I believe. And that's my belief, you know. So what we are trying here in the city of Charleston, we're trying to be a little proactive and trying to ease it in and say, okay, this fine is going to be this fine. This fine is going to be that fine. Nobody want to get a fine. So they might change and make some different opinion on doing things in their business. And loud music, you know, just cut down the music on King Street. You drive down King Street, man, you think this is New Orleans sometime. I tell you, on Louisiana, we drive down King Street sometime on Friday and Saturday. Music this way, music that way, boom, boom, boom. You can't even hear yourself walking down King Street or even driving down King Street. So this is all we are saying. But they still can operate and still make some money to be able to fend for that with their family. And that's all we're saying. And that's the way I believe what's going on now. Thank you.
Thank you. Councilmember Gregory.
Councilman Griffin said so much. And
I tend to do that.
I'd like to peel it back just a bit, because I think what you said is the wearing the mask is not working. So we have two alternatives. We either shut it down, okay, or we learn to live with it. And I wonder where I've heard that before, okay? Because learning to live with it is just simply herd immunity. Only the strong survive, okay? So if we deal with the mask issue, okay, we know, and CDC has said, okay, that if we all wore masks, the spread would go down significantly. The city of Charleston, while I will agree with you, okay, while we had a mask ordinance in place, enforcement was in fact lacking. And I think as a result of that, it's a part of why we are where we are now. However, I do think within the stronger enforcement provisions in this ordinance, we at least owe ourselves an opportunity to enforce and to even make some examples out of people. Because I think until we start making examples out of people that we're serious with regard to enforcement, then I agree with you. Things would continue as usual. A lot of folks will not be wearing the mask. And as a result, subjecting many of us to the virus. I think if this ordinance with its enforcement mechanisms in place, okay, doesn't work, then we may be headed to what you're suggesting, shutting the whole thing down. We may be, but I think that we do owe, okay, ourselves as well as the businesses in this community an opportunity to adhere to the rules, regulations, and restrictions accordingly. Because I echo what Councilmember Mitchell said. All you've got to do is go down King Street and take a look, and folks aren't wearing masks. But I think as we ratchet up the number of people who will be able to enforce it, okay, that we owe the business community and ourselves an opportunity. Remember now, Councilman Griffin, you were one of the ones who voted, okay, to allow this stuff to be voluntary, okay, even with the restaurants, okay?
Right.
And at that time, I strongly opposed it.
Councilman Gregory, what happened to your audio?
Gregory, Dudley, we can't hear you suddenly.
You
went on mute.
There you go. I think you're back now.
Okay, and I don't know what's going on. My internet is probably, that's good. The point I'm making, Councilman Griffin, is I think that you made some very, very good points. But I do think, okay, that health and the economics of this city go hand in hand, okay? If you push herd immunity on this town, you talk about an economic impact. We won't have to shut it down. The world will shut us down. You talk about tourism, okay? If you go with herd immunity, this city will be shut down for years, So while I'm in agreement with you that the lack of enforcement with respect to mask is a part of the mask wearing is a part of our issue here, okay? I do think that the extreme of going to herd immunity and this new language of let's learn to live with it, okay, is not the right approach. I think what we need to do at this point is to pass this thing, okay? And if it doesn't work, we may have to go to your first recommendation, shut it down, and shut it down now. Because remember, we have to look at this long term. We are a hot spot, okay, in the world. The world now knows about Charleston, the #1 city, okay? So it may have to reach a point where we may have to shut this place down and get things cleaned up so that not only are we protecting the health of our community, but we're also protecting the economic long-term benefits of our community. We can't look at this in a short-term vacuum. We've got to look at every step that we take as a long-term fix, okay, to our economy, as well as to the health and well-being of our residents.
At this juncture, could I ask for, entertain a motion to approve number 6? We never got one on the floor.
Second.
Okay. And if I could just recognize anybody who hadn't been heard yet on the motion, and Councilmember Saccharin, I think I called on you once before, so let me go to Councilmember Waring and Shade, and then we'll come back to you for a quick follow-up. Councilmember Waring.
Thank you, Mr. Mayor. Listen, I agree with most of what has been said. If you can remember, Councilman Griffin, when we did have a shutdown and we did open back up, I think it was 1 or 2 bad hours or whatever, we were going to try to get them to come in, I guess, compliance. And I think some of the members of the peer group spoke to those bad actors, and I think initially it worked. But I think it's simpler than this. You know, if people are talking about their, civil liberties, but you don't have the civil liberty to infect somebody else. And that's what's going on here. I'm going to support this. But I can tell you right now, if there was a motion ready, willing, and able, and I'm ready for my email to blow up on this, to go to the shutdown, I would vote for that. And I'll tell you why. Health is more important than the economy. You don't have an economy without health. You look at, anybody saw the Washington Post this weekend? A South Carolinian, Kathleen Parker, who is a nationally syndicated columnist, had an article in there about stay away from South Carolina. We can't have that be our brand. We advertise ourselves, and quite frankly, we're one of the best walking cities in the country, if not the world. So leaving politics and everything out of it, and I think that's wrong. Why we never had a national strategy to date on this, because you had politicians making a decision. When you get down to the mayor and council level, and certainly county council levels, I mean, you're at the footprint of the people. We can't go to the grocery store without running into constituents. You can't go to the dry cleaners without running into constituents. And some of these constituents out here are fearful. What are we going to do? I'm sure all of us have gotten that question in person and online. So what can we do? We know what works. The science has told us what works. We've got wonderful medical professional on the line, still holding on. He could have gotten off after he gave his medical update and answered our queries, but he's still on because he cares about the decision we're going to make today. So when it comes to the health and safety of the citizens in Charleston, I would vote to shut it down. And if that caused me to lose my seat, I still would feel that I made the right decision on behalf of the people. So if the businesses and the people, Costco is pretty good. If you come in there, you're going to put a mask on. And I haven't seen when anybody's really argued with that. These businesses, if they don't want to step up to help preserve the environment in which they invite patrons in to be safe, then as stewards of the city for people's health, I think the next vote would be to close down. And I think we need to send that message out clear. So I'm going to support this. You know, there's no playbook out here for this. We haven't had a pandemic before. I wish there was a book out there to say, do these 10 things and we're going to fix it all. But we're learning as we progress through this. This whole country, if not the globe, is not learning as we progress through this one. I've learned along with you, Councilman Griffin, along with the mayor, along with all the other colleagues on this meeting today. So I'm going to support it. But if our numbers continue to spike like an Apollo rocket going straight up, if you see the charts, that's what the chart looks like. How the old Apollo rocket used to blast off. That's how our charts are. And those are lies we're talking about. I mean, we saw in the paper, it was a 5-year-old that died from this. So making the hard call, that's not a hard call for me. So I'll vote for this. And thank you, Mr. Mayor, for the time. But if the numbers look poor and we have to come back and vote as we did before to shut it down, count me in, because I think we need to protect the people's health first so we can have an economy later. Thank you.
Thank you. Councilmember Shea, then Brady, then Takiyah.
Thank you, Mr. Mayor, members of the council, Madam Clerk. We had a playbook about 100 years ago on dealing with an epidemic or a pandemic. And the city of Charleston opened up too soon, and the result of that was deadly. And we didn't learn from that 100 years ago. Now, we are a municipality with limited jurisdiction, and our partners around us have not always been fully cooperative with us. This takes a universal act on what we're trying to accomplish here. We are in a medical crisis. We are in a medical crisis, and that means we need to take extraordinary steps. And we've done that. When we did it initially, we had very good success with our numbers. And then our state and our country started reopening, and to the against the best advice of our scientists and our medical profession, we opened too soon. And because of that, we've seen these numbers arise. We passed a ordinance back to take effect on July the 1st, and we're going to have a report from our Public Safety Committee meeting in a few seconds. And we brought that up as part of a report from Dan on how we're going to enforce that ordinance. And the main goal of all of that, the main goal of that ordinance being in effect, was to provide for folks to comply with this ordinance, to comply with wearing a face covering, to go out and provide education and information to our general public as the need to go out there, not to take a punitive measure on this, but to get people to voluntarily comply with that. And those of us who were out there with the mayor on Friday night, all those anecdotes that you just relayed were absolutely true. We walked up and down King Street from 9:30 to about 10:30, 11 o'clock. And the number of folks who use their face mask either as something to put in their pocket or as a chin strap were astonishing. And we handed out, I don't know, Mayor, how many we handed out, but we handed out a good number of masks to those folks up and down King Street. And the restaurant folks in the bars and the other establishments were very appreciative of our efforts to doing that, because they wanted folks to be in compliance with that. And then we saw young people shoulder to shoulder lining outside to get into a bar without a face mask on. And it was a very discouraging visual for us to observe what was taking place. So we tried level 1, and now we got to go to level 2. Level 2 now is this ordinance with a much more enforcement power behind it, much more teeth behind it. We've got to enforce this. We've got schools that are going to open up in about a month's time. Our college campuses are going to be populated again within a month's time. Our population is going to increase significantly in the city of Charleston in about a month's time. And that's going to be a good barometer for us to see where this all lends to. And I hope that all of our higher education institutions are going to be very forceful in complying with those students who are on campus while they're on campus and off campus to comply with this face covering ordinance. Otherwise, we will see these numbers go up higher. So here we are. We've got this ordinance in front of us. It's another tool in our box. Let's give it a shot, see where it ends up. And the comments that y'all are making are right on point. If this doesn't work, we may be back to level 2 again, which is shutting down the city. So I urge all of us to go ahead and vote for and support this ordinance. Thank you.
Thank you. Councilmember Brady.
Yes, thank you, Mr. Mayor. I don't want to belabor anything that anyone else has already said, but I think it's easy, especially for a lot of people in the general populace, to have a degree of cognitive dissonance because they're removed from seeing what's going on in the hospitals every day. My wife works at MUSC. She's had to do 2 weeks in the COVID unit. She's a physical therapist. And just personally knowing the toll that it takes on her to have to treat those patients and watch some of them pass away. You know, and I have nurses that live on my street that both work all over the area. And to hear it from the front lines, I mean, they're getting overworked. Some of them had to take pay cuts. They're tired. And if we can do just, even if this one step doesn't work, and I want to address, there's people that have been saying, well, the guidance has shifted. You know, it said one thing, it's saying something else now. That's how science works. You learn more the more that you find out about, especially in communicable diseases. You learn more as you go along. So it would make sense that the science would be working and we would be shifting guidance. So if we know the masks work, let's beef up the enforcement. And we know that, especially in enclosed environments, and this is true of any kind of airborne droplet communicable disease, we know that being in an enclosed environment is unhealthy, especially when it starts to increase. And people have asked about, well, the times, and I'm glad Ms. Rodinia commented on that, because I think you're spot on. It's not that the disease doesn't come out after 9 or the disease doesn't come out after 11. It's just that those are the times that congregation generally will begin in a bar environment. And none of us want to see businesses struggle and go out of business. But if we're not going to have people that can work those businesses because they contract this disease, and we're not going to be able to have people to visit those establishments, then there's no point in having an economy in the first place. And so I would just encourage everybody to, if we can do anything to just help ease the burden on our healthcare frontline workers, including like my wife, you know, not only would I greatly appreciate it, but I know they would too.
Thank you. Councilmember Seeking.
Thank you, Mr. Mayor, and I'll be very brief because a lot has been said. And I think one of the messages that if anyone's watching or listening or is thinking about where we're going after this is, if we come back and have this conversation again at this level, I think everyone knows what our next step is going to be. And Dr. McLean used a term that I think we should all keep in our minds as we go forward, not just us on this call, but everyone in this community. And he said, when we asked them, you know, what's your best advice to us to curb this thing, to get a handle on this thing, to get out the other side of this thing? And he said, significant social intervention. And everything that we do as a community, I think we need to ask ourselves, are we making some form of significant social intervention to get to the other side of this? And what is one of the catchphrases we hear and we've heard since we were kids about law enforcement and public safety and taking care of your environments? If you see something, say something. And we've got to get to a position now in this community, if we see people putting us at risk and danger, say something. Don't be afraid. We're going to pass this tonight, but from now on, the significant social intervention has to be a collective effort of all of us to encourage people strongly, not just through fines, but through making it part of your daily routine to get on board and get beyond this. Because if not, we will be having this conversation. It will hurt our economy. It'll hurt our health. It'll hurt all of those things. So significant social intervention at every level, not just at the government level, is something that I think we need to make sure the message is out there. And nobody has the platform more so than you, Mr. Mayor. Let's make sure we get out there and let people know that this is the most important thing you can do right now for your community is get on board, do things that we know that make you safe, wear a mask, socially distance, stay at home if you can, and we'll get beyond this. If not, we're gonna be talking about it this time, maybe even next year, and that's not what we want to be doing.
It's in everybody's self-interest. And speaking of see something, say something, I did want to share with you and anybody listening that we have a livability officer embedded in the call center who's taking calls regarding this matter. So rather than call 911, any citizen could call 724-7311, our regular customer citizen service desk. And if you see something, say something, call that number. Okay, got two more that haven't been heard from, Councilmember Appel and then Del Chapo.
Thank you, Mr. Mayor. I think Councilmember Seekings really hit on a serious and important point here. This needs to become a social norm that's widely accepted. This thing has unfortunately become politicized, which is just the worst thing you can do in a national pandemic. I mean, you look around the world, you see left-leaning governments doing what they need to be doing. You see right-wing governments doing what they need to be doing. This is not politics. We know it works. This isn't rocket science. It's wear a mask, it's social distance, it's crush the curve and don't let off the gas. But we failed to do that. And frankly, this should not even be at the city council level. The fact that it is demonstrates a failure of leadership at the federal and state level and regional level. And I might rub some people the wrong way by saying that, but that's the reality of it. The countries around the world that are making progress on this thing are not handling it at the city council level, because the reality of it is our tools are limited in terms of enforcement and in terms of geographical and jurisdictional scope, right? We can shut the bars down the late night on King Street, but the young 20-year-olds that we saw on Friday night, Mayor and Councilmember Shayed and Saccharin and Del Chapo and everybody else, they're going to Shem Creek. They're going to house parties. They are young. It's the summer. They don't have anything to do. They want to get drunk and they want to hook up. That's the reality of what's going on. And there's only so much we can do. It's going to take much more cooperation from all levels of government, from the culture, from everybody to start getting this thing under control. I mean, this should be a sign of patriotic pride to wear a mask, not some you're a wuss or you're some girly man because you're wearing a mask. That's what that's the interactions I was having on Friday night when I was walking around handing masks out to dudes. I mean, it was a weird dynamic, but that's where the culture is right now. And here's what we're looking at. No school in the fall, no college football in the fall. Can you believe that in the United States of America, we are really looking at not having college football this fall? I mean, that's a reality. I mean, you've got the conferences right now, playing little games, or we're going to cancel the non-conference. Everything's getting canceled, more likely than not. That is a national failure. We are failing right now as a nation, and it's outrageous, and it should be embarrassing to every American. We just celebrated July 4th, American exceptionalism. We are an exceptional country, but we are failing this test on a national and statewide level, and it's embarrassing. I mean, we're going to be watching, Premier League soccer playing in Europe, while we're it's going to be pathetic. Other countries are doing a better job. So we've got to find a way to get a hold of this. There's no ordinance we can pass that's going to get a hold of this on its own. It's going to take much more than that. But this ordinance that we have before us tonight is an important start. I'm much more inclined to, call me crazy, I'm much more inclined to listen to Dr. McClain than some of the maniacs on Facebook that think that this is like a New World Order plot to take away people's liberties and things like that. It's absurd with where the discourse is in this country. But we can set the example. We can start to take action. And last thing I'll say is this is going to put late night businesses, music venues out of business. I mean, I heard from the Poorhouse, a wonderful establishment in my district over on James Island. They said this amplified music thing is going to put them out of business. And I don't think that was the intent necessarily behind the ordinance. This ordinance has got the best of intentions, but that's the reality of it. And that's one of the problems of having these decisions fall upon local government. because we can deliver the boom, we can shut a business down or severely curtail their income, but we can't put money in their pocket. We can't soften the blow. Only the federal government, maybe the state government can do that. That's what's necessary, because these businesses are being called upon to do an act for the betterment of public good. And that's the reality of it. And so I don't know, I've covered a lot of ground. I know we've talked a lot about this. I think this ordinance is the right step. We got to pick it up on enforcement, and the society and the culture has just got to wake up before we become, before we preside over just an unnecessary, self-inflicted national tragedy.
Thank you. Councilmember Dale Chapo.
Thank you, Mr. Mayor, and to my fellow council members for giving me some time. I guess the fact that we've gotten to this point is very disheartening, and just blows my mind that, I felt like only a couple months ago, we were so happy that we were below 400. And that seemed like it was just a couple weeks ago. And gosh, what we wouldn't give to only have 400 cases now.
Statewide.
Right, exactly. And, we can't, I guess, this is about respecting one another. And the fact that a government has to step in and teach you what you should have learned in kindergarten is beyond me. You cannot expect a single mom working at least one full-time job, living paycheck to paycheck, to also be school teacher and daycare worker and extracurricular activity counselor. She can't do it. And believe me, single moms are superheroes, but there's only so many hours in the day. And that's what we're asking them to do, to, sacrifice being able to provide for their family because their children can't go to school. Teachers shouldn't have to make these decisions. And I know that Councilmember Seekings and Appel mentioned it, and every single one of us, I know business owners are hurting. And I feel that pain. I hear it from, businesses all over the place, how much they're hurting. I also hear from moms and dads and our senior citizens and across where everyone is hurting. Everyone. This is like an equal opportunity offender, this virus. And I came into this, and I'll admit, I came into this going, you know what? I don't think I can support this. I can't put, one more government stipulation on the public. But then I thought more and more about it. And if our citizens aren't gonna do it themselves, we're kind of left with no choice. I hate the idea of writing someone a ticket because they won't put a mask on. But I mean, I don't know what else to do at this point. And some businesses are never going to reopen, businesses that have been around in Charleston for 40 plus years. And that's awful to think about. And I hate that. And I hate that they can't play music after a certain time or serve alcohol after a certain time. And all of these things, I just don't know any other solutions at this point. And I want them. And honestly, we can pass every law in the book, but until folks decide that they just want to respect themselves and one another, we're just going to keep spinning our wheels. If I knew I infected someone with coronavirus, I would feel like the biggest jerk. Yeah. If you infected me with coronavirus, I think you were the biggest jerk. This is so hard, and I hate these no-win situations that we've been put in, and over, and I could already feel my inbox exploding, like other council members have mentioned. But I just beg of anyone who hears my words, think about your grandma. she's scared. And you know what? You would put on a mask to make your grandma feel better. So when you go to the grocery or something, other people's grandmas are in that grocery. So put on a mask for them. Regardless of your personal feelings, do unto others. Live that Christ-centric life. And if Christianity is not your faith, I did an invocation a couple weeks ago showing that every faith comes down to the same thing. And it's that we are all created in God's image, not only certain people, all of us are. So I just please ask of people to take that to heart and think about those single moms and think about those kids and just really lean on that, because it sucks. It really does. And none of us like having to do this.
Thank you for your passion and your remarks. And all faiths tell us to love one another and be care for one another. And we're at the point where we can't do that as a society if we're spreading this disease, really. And many times docs will tell us you might be infected with this disease and not even know it. So it's been part of the problem. And I'm sorry also that this impact is so heavy on one of our core businesses, what Charleston is all about, being a food town, a hospitality town. But just the nature of the business, when you're drinking and eating, you got to take your mask off and you're congregating, and that leads to the spread of this contagion. So you're right. We're just awfully between a rock and a hard place. Well, this is not fun for any of us. So thank you for all of your thoughtful comments. And can I call a question at this point? Would all in favor of the motion to approve the motion number 6, please say aye.
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 Any opposed?
Nay. Harry. Nay.
Okay, so I have 2 nays for that one. Okay.
No, a nay, me, Harry Griffin, nay.
Councilmember Speakings, did you vote?
I did.
Was it a nay?
No,
Okay, all right.
it was an aye.
It was just one. I thought I heard 2. I know I heard you the first time.
I see Dudley up there. He saw how I voted. He's right above you on my Hollywood squares here.
Okay.
Okay.
So, that was a little long. Do y'all want to continue right along or take a little 5 minutes?
Yes, keep on going.
Yeah.
We'll continue right on. So next up is our Committee on Public Safety, Councilmember Shade.
Thank you, Mr. Mayor. And we had a meeting on July 1st. Appreciate all the work of the members of the Public Safety Committee have dedicated on this. We received an update from the May 30th riot. I forwarded to all members of council the 4-page report or summary we received from Heather Malloy, and also the link to the tapes of the 6.5 hours of radio transmission that were capitalized for us. You should have that available to you. That was in reference to a Freedom of Information request, that also the part of the ongoing internal review of what occurred on May 30th. If any other questions about that, I'm glad to answer that. I think Chief Reynolds is available for us. There were some other instances that occurred over the weekend regarding what happened in the assembly on White Point Gardens, but they're continuing to make arrests from the riot of May 30th, and they're continuing to enforce these laws regarding civil unrest. We also got an update on the vandalism at the Charleston 9 Memorial Park. There was an arrest made on that. It was not connected to any of the other civil unrest that we had experienced in the city. Like I mentioned earlier, we did get an update from Dan Riccio on the face mask covering ordinance. And as I stated earlier, the purpose of that was to provide for an educational component to face coverings and to get people to comply with that. And then we had an update on the construction on Fire Station 11. I think Chief Courier is online, and also Chief Reynolds is online for any other questions. But Chief Courier, can you just give us a quick update on where we now stand with the completion of Fire Station number 11? Then we'll call on Chief Reynolds to comment on anything that we may have regarding my comments about the update from May 30th. Chief Courier.
Certainly. Good evening, everybody. Just a very quick update on Fire Station 11. When we met on July 1st, this is information that was passed on by Jason Kronsberg at Parks, but the building was 87% complete. Jason estimated that it could reach substantial completion by the end of July. And the mayor asked if substantial completion was at the end of July, when the fire department thought it may be able to occupy the building. And best guess I've got is that with the punch list that the fire department will generate, we may be able to be in that building by September. So I drove past it this weekend, and there's noticeable work being done. And just publicly, I want to thank everybody for pushing this to completion for us, especially Jason. And I do know that he is on the line. So if there are specific technical questions about maybe the construction timeline or where we stand, Jason would probably be the most appropriate person.
And I just want to add in, why Chief Courier is available. We all got an email about Fire Station number 8. And so we're going to call another Public Safety Committee meeting in the next couple of weeks or so to give a more update as to the status of those stations with Station 8, and also some more ideas about capital needs for the fire station, for the fire department. And Chief Reynolds, I see that you're available. Anything that you want to add on to what I commented on about the update from the May 30th riot?
Just a couple things. One of the things that was highlighted by our attorney, Heather Malloy, who gave the briefing, was that in all that night, there was 10 arrests made associated with the evening of the 30th. And since that time, a total of 74 arrest warrants have been issued. And actually, I believe it's a little bit more than that. That's what was covered in the Public Safety Committee meeting. There's been some additional arrest warrants. 27 offenders have been identified. And actually, again, that number has increased. 65 of those warrants at that time had been served. The total number of offenders who'd been arrested to date then was 23. Again, that number has increased. The charges include arson, burglary, inciting a right, assault, and battery on citizens and police officers to damage the property. And there continues to be additional follow-ups. One of the things with this past weekend, I think that you wanted me to mention, is that we have reinstituted our permitting. So although we continue to grapple with the COVID challenges, we have reinstituted our permitting, and that enables us to work with the protest groups and have a little bit more accountability. And we've had a lot more success because of that. And if I could just briefly read you a statement that kind of ironically overlaps what was just discussed with COVID and what we're talking about with these protests. I just got this from Chief Holbrook, and it's reference to the passing of Columbia Police Officer Robert Hall. It is with a heavy heart and a tremendous sadness that Columbia Police Chief Skip Holbrook announces the passing of Master Police Officer Bob Hall early this morning. After receiving treatments at Baptist Hospital since July 5th, 57-year-old Hall, a 35-year veteran of CPD, died from complications due to COVID-19. Prior to becoming ill, he was a valuable part of their special events unit and did a variety of things, which included responding to the riots and the hostile protests at CPD headquarters on May 30th and May 31st. Just echoing the seriousness of what's already been discussed, just got that literally as we were sitting here.
Thank you, Chief Reynolds. I think that to sort of drive home the point that we have our medical personnel on the front lines. We have our first responders on the front lines. They're the ones who are constantly exposed to this virus. And we've got to always keep them in our minds as to what we're sending them out to do. So our hearts are heavy with the loss of our sister city, Columbia's loss of their 35-year veteran on the police department. And we just got to always be diligent. Thank you for that report, both Chief Courier and Chief Reynolds.
Mr. Chairman.
Yes, sir.
Listen, I have a question about the Fire Station 11. I've ridden by, and you're right, it is looking a whole lot better. As a matter of fact, the lights are on. But that state, I'm not asking for this answer today, but certainly we can get this between the next meeting. But we know that station is late, so I'd like to know how many days is late. And I believe where we were, we had to, if we were out by a certain period of time, we had to pay rent. I'd like to know how much rent that we've paid. Again, so if that information can be provided to myself and council between now and the next meeting, would be great. Thank
Yes,
you.
sir. I think we can get that for you. And also, I think that the part of our contract with the builder went into that stage of a penalty component as well. And we can get those numbers to you as Councilman Waring. That's what they will be owing us, I think, when that settles.
Thank you, Mr. Chairman.
Thank you. Thanks for the question. That's all I have, Mr. Mayor. There's no things we need to take a vote on at this point, but that's our update.
Terrific. Thank you. Next, we'll go to our Committee on Public Works and Utilities. Councilmember Waring.
Thank you, Mr. Mayor. Public Works and Utilities met yesterday at 4 o'clock. As you see on your agenda, we had a discussion about a report from the Underground Advisory Committee. And in effect, the net of that was basically the tree cutting is, although in some cases it looks horrific, it's within the proper guidelines in our contract. A lot of the conversation centered on trying to beef up our ability to put lines underground and search for best practices, not only here, but in other municipalities across this region, not the state, but outside the state, because I'm with the understanding, and the committee is too, that there are a number of ways to fund, not just one way, but a number of ways to fund putting lines underground. That's the real long-term solution on that. Which also, I would say both of them went into a dual conversation between the underground as well as tree trimming. Down in item B, stormwater discussion. It was just a discussion on Angel Oak parking area, which actually is very preliminary, and the city is in conjunction with, I believe, Low Country Open Land Trust and others, obviously to be very sensitive and how that parking lot is done. There's no drawings out there. Some of you all may have gotten calls from media on that to show you. I know I did. Show plans for the parking lot. We are that much preliminary into the process, so very early on in that. Conversation that Councilman Seeking is owed some credit to on this. We had a coordination discussion, Councilman Seeking, with CWS representative and our committee and Mr. Fountain on coming together on these sinkholes and these arches in particular, where the city has been picking up the responsibility, and we all know it's a joint, we know now anyway, it's a joint responsibility, and that's gonna that went very well, I would say, on that conversation. And then we got into the stormwater updates. For that, I'm gonna turn to Mr. Fountain. And Mr. Fountain, if you begin the stormwater update, please.
Sure, thank you, Councilman Waring. Just run through these very briefly, so let me know if anyone has any questions. But Spring Fishburne Phase 3, that project has hit substantial completion. Basically the tunnel work and the functionality of the project is now complete. The King Street US 17 ramp has been reopened, and we're just basically finalizing some surface site restoration, Harmon Field and some of the other sites within the next couple of weeks, and then that contract will be closed out. And to note that it did come in under budget for total project costs, so that was a nice thing with that phase of the project. Spring Fishburne Phase 4, the excavation work is continuing between the Ashley River bridges. That's what the main work you'll see for the next few weeks in that location. We are moving along with the test pile work for the H piles and be getting ready to go into production on the H piles, which are basically the pile supports for the outfall structures out between the the bridges on the box culverts that will extend out and release the water into the Ashley River. Spring Fishburne Phase 5, we mentioned this was the mayor's favorite update of the meeting, that this was the infrastructure bank had approved $21.5 million towards the project last week. We're currently working on finalizing the scope with Davis and Floyd for the pump system design and bid support. These pumps are very, very large pumps, so they have a very long lead time. They're kind of custom manufactured for each application. So we'll actually finalize finalize our design and then procurement for those pumps in advance of the actual final design and construction contract for the remainder of the pump station. That should be coming to council in the next couple of months.
Mr. Fountain, if you would
yes.
pause right there, Mr. Mayor, would you address that 21.5 or whatever figure funding that came into the city from that application? I think that one deserves a little bit more explanation, Mr. Mayor.
For the from the STIB board?
Yes, sir. Yes.
Yeah.
Sir.
So I know you all heard we sent out a notice and it was in the paper, and we were so excited to get approval of a 50-50 match for the balance of completion of the estimate for the Spring Fishburne tunnel system that basically covers a 500-acre area. It'll basically pay for the last phase 5, the pump station portion of the project. And in addition, Charleston County was successful and got awarded a grant to help complete the transportation improvements at Main Road and Savannah Highway, really all the way from Bees Ferry out to River Road on Johns Island, improvements to Main Road to the tune of $40 million. And it was a county application, but it was also on our citywide transportation plan. So both of those were just very good and exciting news. And I thank the governor on this count for helping us, and local member of the STIB board, Chip Limehouse, and the other members for their support. Senator Camps and other officials were helping make that successful. But I think mostly it was in the application itself. So thanks to Matt and Councilmember Shealy. Where are you? There you are over there. I think of you often whenever we get a successful grant. Sarah Fischera, our grant writer, did a fabulous job writing this up. And you were such a proponent that we get her hired when you came back from the National League of Cities. So she's more than paid for herself, Councilmember Shealy. Thank you for being such an advocate for that effort.
Thank you, Mr. Thank you, Mr. Mayor. I mean, that funding was just so important. It virtually affects the funding affects all 12 districts, this entire city. So that was a really big one. I appreciate, if you remember, Mr. Mayor, the staff had to really work literally around the clock over the weekend to get that application in. So kudos to everybody on staff, legal, everybody that participated in getting that application into the STIB. Continue, Mr. Fountain. I'm sorry for cutting across, but I thought that one was worthy of a highlight.
Thank you, Councilman Waring. And moving on to the other projects, the Medical District Tunnel Extension, we've prepared easement documents and provided those to the MUSC board, who's currently reviewing the documents to provide dedication that we can then bring back to council for easement approval. The low battery project, the exterior wall removal and replacements complete. We basically have the walkway platform installation ongoing, and we're working on installation of the actual drainage structures in the roadway corridor. The King UG project, we've received our DOT encroachment permit. We've completed our final environmental sampling work, and we're finalizing our bid phase preparation for the surface drainage improvements on the project. We've also completed the preliminary engineering work on the pump station, and we're putting together the scope with the consultant for the final design and permitting of kind of the most optimized pump station and outfall from that preliminary engineering work. And we'll be bringing that to council also in the next couple of sessions. The and I should point out the construction of that project is still looking to get going this calendar year. We will obviously see some traffic impacts during that, so we'll need to spend a lot of time coordinating with the community and the neighborhood and getting the information out about that one. But the first phase of that project will provide some very minor flood improvements, but really the focus of that first phase is to be able to collect the water and bring it to the pump station that will be installed in the second phase of the project. That one is making good progress. Forest Acres project, AT&T did provide us with an update that they had completed a significant amount of design work for DOT in response to some DOT encroachment permit applications regarding the impacts to Playground Road for relocating their duck bank so that we can continue our portion of the drainage project. And they're waiting to hear back now from DOT on how that will be resolved. The Market Street project, we have received almost all of our city permits. We're just finalizing our last TNT permit based on the mid-block crossing, which we expect to have resolved pretty shortly. Our DOT encroachment permit has been reviewed, and DOT only came back with very minor comments, so we expect to have that approved shortly. At that point, we'll be able to take the fully permitted project to Dominion, and Dominion will start work on their undergrounding design, so we'll have to be coordinating with them on that project. The Central Park Drainage Project, the city has provided its final comments on the kind of final draft report to our consultant. Consultants making their last revisions on that. We should have it ready to present for the James Island Drainage meeting on July 22nd. At which point we'll then need to look at moving forward into a design and permitting on those phases as well. We've talked with Charleston County, who wants to collaborate on that project, and looked at some different options of splitting up different approaches to the project. So that'll be another good collaborative project with hopefully funding coming from both agencies. The Barbary Woods Drainage Improvement Project, we are just about finalized our contract for preliminary design services. That should be coming to the next council meeting for approval for that drainage improvement design. The Windermere Drainage Improvement Project, we're currently negotiating with the engineering firm that was selected by the selection committee. We should have that scope negotiated and ready for council review within the next 6 weeks or so. Bring that to council as well. The Church Creek storage projects, that request for qualifications advertisement is currently on our bid line. We had our pre-application meeting with a number of interested parties. Qualifications packages are now due back to the city on July 23rd, at which point we'll convene a selection committee and review those packages. The Broad and Lockwood Sunny Day flooding concept review, we have reevaluated the draft report from our consultant, made some comments, and we're just waiting to get back that final draft to be able to discuss the results on that approach. And then again, that's looking for some type of knee wall or other method of preventing sunny day flooding on Lockwood down near the Broad Street intersection. This is just the concepts of different design options that are available for that approach.
Matt, who's the consultant on that one?
Yeah, that's JMT. JMT is doing very similar work on the battery at a much larger scale, but they have the same geotech work and the basic same knowledge of the site and the geotechnical loading. So they're able to do quite a bit of kind of cost efficiency on giving us data that they're basically using from one design on one project just down the street on this project as well. The Waterfront Hotel, this one's a little unusual in that it's a kind of a collaborative project, and that the hotel had to relocate a drainage pipe that was on an easement on the hotel property. As part of that relocation, they agreed to basically not just replace the single pipe with a new pipe and new tide gate and Army Corps of Engineer permitting for the relocation, but to install a second PAL supported pipe along those lines. So we'll have, that was the original 1984 recommendation for that section of the peninsula. So that drainage basin now should be brought all the way up to standard with basically brand new PAL supported pipes with outfall valves. And we should see some real improvement to flooding in that area as well. And that was with the city paying a small, basically small portion of the cost of the additional pipe. That pipe is actually constructed, and we're just finalizing backfill and surface improvements at this point. Danoon Drive, that project has been completed and closed out at this point. Lord Calvert, that project has been completed and closed out. Weems Court, the first 2 phases of our repairs are complete and closed out. We're underway on our 3rd phase of the repairs today, and we believe we'll be able to complete the project with just this 3rd phase and not need another step as we keep finding additional failures and impacts on that. We think we've gotten all the way to King Street at this point, and we'll be able to restore drainage through that whole road corridor. The Sherwood Drainage Improvement Project, we had fence removal is complete, tree removal is complete. Field Ops is on the project site laying out swale and pipe installation work. And we are also, we discussed at the committee meeting how this drainage will actually be modified slightly to improve the drainage at King Richard, which is a little road community just to the north of this project site, by letting basically that community be able to drain south as well as north, which is the original design for the community, to relieve their flooding as well. The South Anderson check valve, this is a collaborative installation of a check valve on James Island with the town of James Island, who's paying most of the cost while we provide most of the technical support. That actually is being installed tomorrow morning at that location just north of camp, which will help with most of the flooding kind of south of camp and east of Folly Road. Mueller Drive, we have our field survey scheduled, have that contractor on board to lay out easements so we can develop our final project plans on that property. And then the Concord Street pump station, we completed some emergency maintenance. It was on the bids and purchases today. That basically involved dewatering the pump station using the Port Authority cruise area parking lot, which was available at the time, and the sending salmon's dredge and divers down into the pump station to remove some debris that had been clogged into the pumps. And we're basically prioritizing moving forward with some of our rehabilitation and reconstruction work for that pump station. Again, we've talked about it briefly, but we're at about 20 years of age on the pumps and control systems. So we're going to bring that scope back towards Public Works Utilities to review as well, as we really want to get that prioritized and make sure we don't see any excessive downtime on that station. For floodplain, we just had a couple of items. We did close on another property for the property acquisition from repetitive flood damage properties at 1167 Shoreham Road on James Island. So that property will be in the, we've closed on it. Now we have to demolish the property, and basically we'll be looking to retrofit that property like we're doing in Church Creek to create a benefit, not just a removal of the structure and the small benefit we get from that. We also did get finalization with our CRS cycle visit. We did get it pushed back slightly to early December of 2020. It's going to be December 9th. So we have our final date. We'll be trying to drop our score by 1 level to basically get an additional 5% of insurance savings on anyone who owns a flood policy in the city of Charleston. And we discussed briefly a rehab project at 914 King Richard regarding some building permits, see if the 50% rule applied. And I think building services was going to provide a follow-up inspection to make some additional checks on valuations on that property. I think that's all I had, Councilman Waring, unless there's any questions.
Is that all?
Well, thank you, Mr. Fountain. You all see the comprehensive approach that Mr. Fountain touches on drainage projects in all 12 districts. So it's all across this city. Progress is being made. Thank you, Mr. Fountain, for your comprehensive approach. I really do appreciate that. We had a discussion about the Dominion boring basically under the creek to supply power to Ghost Island. Obviously, there were some comments on it during public opinion. We had a long discussion on this aspect. Should we be advocating for the electrification of small islands? It's not personal. I mean, these people are great people. I've met with them myself. But we have a lot of these islands around in and around Charleston, marshland. Should we be doing that? The neighborhood association has already filed an appeal, and the prospects were put to our committee should the city take an official position and on this electrification of those islands, or of that island in particular, because it will be precedent setting. And so we brought the discussion forward to City Council. Obviously, neighborhoods on probably both sides of that island aren't satisfied with it. These people have the right from planning, I guess, to build a house. I don't think we're trying to rezone the property. But they also can build off the grid. I mean, we've got television shows out there how people secure power through solar power and other alternative means. So the idea of you know, power line going underneath the marshes and coming up, should we support that as a city, or should we take a stand on that as a city? I see Council Lady Jackson hand waved, so I'm gonna recognize Council Lady Jackson. If it's okay, Mr. Mayor. You're on mute. You're on mute.
Yeah, thank you, Mr. Chairman. I think I was trained that in order to put this on our discussion agenda, we need to have a vote of council now in order to do that. Am I correct about that?
No, it's coming up from the Public Works Committee. So it was on the Public Works Committee. It's just part of reporting out to City Council, our discussion. And if council chooses to take an action, or if the mayor chooses to take an action, we can. But it's part of the report. We don't have to add it to council's agenda.
Okay, great. And I do have some comments.
We can certainly discuss it. This is a clarification that was pointed out that if we wanted to take action, we would first have to add that to the agenda, which this body can do.
Okay, yes, sir.
Okay, well, I would like to start a discussion, and I hope that it would end in action. I think that I appreciate that I listened, you know, as you all know, to the discussion at the Public Works Committee, and I do think that you covered a lot of very pertinent and probably compelling topics for what the council should be considering into the future, and, you know, making more of a zoning issue on these hammock islands, as we've been educated to call them. But I think for this particular case, that is an active development site, a single development site, that there's a very simple next step that I would encourage the council to discuss, and then actually take a vote on putting a motion forward. So my discussion is that the simple next step is literally to authorize the mayor to send a letter to the permit officer who's been shepherding this permit that Dominion Power has been needing to get in order to install electricity using a 1,100-foot run under the marsh that surrounds this hammock island. And right now, the permit has been approved at the local DHEC staff level, and it's being appealed. And so all we need to do in order to keep this simple answer going and look at this, give this site the respect that I personally believe it deserves as an historic location that has one-of-a-kind history in Charleston, is to authorize the mayor to send a letter to DHEC asking for a full DHEC board hearing about this appeal. We don't have to give our opinion one way or the other about what we think on whether the marsh should be disturbed for this purpose. We don't need to weigh in about electricity. All we need to do is say that we think this case needs a full DHEC board hearing. And I would submit that it does, because it's a unique site. And more importantly, it's part of the Maryville-Ashleyville community. What was a town that is now a beloved and historic neighborhood in the city of Charleston. So I think, and then it gives 30 days for the applicant to really sort of, you know, what I would call do his knitting with the community and with us to really help us understand the holistic intentions for this site. There's a lot of rumors flying around. I don't do social media anymore because it's just, you know, too uninformative, but I know that there's a lot of rumors flying around about what the real intention of the owners is for the site. I don't think we need to go there, but I do think we need to offer an opportunity for the owner to come in, and now he has an attorney, to come in and give us a very start to finish picture for what the site is intended to be under their ownership. Also include the Maryville neighborhood into that. And then, you know, then the regulations that are in control take over. I mean, I do feel like it's fair for us to say, especially with new council members in office since January, that this whole case came before us as sort of an after the fact set of circumstances where the ownership had taken place and the dirt was disturbed in a variety of ways by the installation of, you know, self-sufficient infrastructure, basically. I understand a water repository for drinking water, solar panels, a packet system for septic, a shed. So there was a lot of things that were actually constructed and done on this island before any of our inspectors or permit staff knew anything about it. And that's where we were left off with the council in December of 2019. So I know there's a stop work order. I'm totally assuming that the owners have, you know, respected that and have not made any more changes to the property until they can go through these proper regulations. But I do think that we have an opportunity to at least give this property the full hearing that I think the weight of its history and its location in Maryville, Ashleyville deserves. I have, you know, my one word for the owner, and I know that they probably have all of the law and the regulations on their side as their lawyer has laid out in front of us today. But I guess I would appeal to their sense of community, and my faith informs that to whom much is given, much is required. And I think this family has been given much in the way that they used their resources for good in this community. And as a result, they are in a place that is very dear. Yes, it had been neglected. I understand they have done the right thing by taking away trash and garbage and, you know, corrosive materials off the site. And that's all wonderful. But I do feel like they should be going the extra mile to live into their vision for the property and really bring all of us along into it. So that's what I have to say. I would like to see us take a vote to authorize the mayor to send this letter. It's a very simple request that he would be making of the DHEC staff, and then they would have a full board hearing and in 30 days. Thank you.
Okay, Mr. Councilman Saccharin, it's your district, and I think Councilman Shahid's district. Any comments?
Well, I just want to echo Councilwoman Jackson. I fully support you know, Ms. Hamilton and Ashleyville Marysville's appeal for this to DHEC fully. And there's three things I want to echo just in that appeal, which is one, the environmental concern that I have with that island in that community. I mean, it's one of the oldest communities we have, so I certainly have some environmental concerns. Number two, you know, based on my understanding, a lot of the work that was done has not been permitted, and I haven't received a full answer whether that work was permitted. And I'm happy to have that conversation with the owners and sit down with them in person. I'm available for that. And then lastly, the question of whether there's, you know, essentially a cemetery and human remains still left on that island, that hasn't been fully answered for me. So those three things need to be answered, and I fully support Ms. Hamilton and Ashleyville Maryville's appeal and their decision. So thank you, Councilman Waring, for calling on me.
Okay.
Thank you, Mr. Councilman Waring, and I'll weigh in as well. So the island actually sits within my district, and for those of you who are not familiar with it, this is an island that is situated right across from Charleston Landing. It sits across from the creek from Maryville, Ashleyville. West Pawnee neighborhood. And as Councilman Warren reminded me yesterday, the new county park that is being soon to be developed is right behind this as well. It's a very unique island. The owners purchased it, and to their credit, and I say this with all due respect to them, they have done a marvelous job of cleaning up this island. And I forgot the number of barges that were stated as what they took off that island, the debris, the trash that was dumped on there. They've done a magnificent job of providing a sense of sanctity to that island. Historically, it's called Ghost Island because the early settlers would bury their dead on that island. And there were some other folks in the Lining family historically that we can document at one time were buried on that island. That's why I got the name Lining Island. That's why I got the name Ghost Island. There's some questions as to what human remains are on that island. There were reports that none exist out there whatsoever. So there's still a question up in many people's minds as to what still exists on there. I pass by this island when I take my pleasure boat out around. I see it. There are solar panels out there. There is a structure out there. And Councilmember Jackson and Councilmember Saccharin, y'all's inquiry is correct. A stop work order was issued to them in December of 2019. The work that they reportedly started out there was not permitted. So that work has ceased. I can't tell if there's any more work being on there. It doesn't look like it has been. This area is very sensitive to a lot of folks, particularly to the folks who live in the Maryville-Lashleyville area. And it's very important to them. I want to work with the owners. They have a right to use their property within the restrictions of our city codes and our city rules and regulations. There's going to be a huge issue as to what they're going to be allowed to build out there, if anything at all. One of the issues, and I've had this conversation with Chief Courier and our fire marshal, is that there's going to be a problem with responding to a distress call. This is an island, and there is no land access to that island. And so whether or not they're going to be able to be permitted to get a certificate of occupancy is going to be very questionable, because the police and fire departments are not going to be able to respond out there, and particularly in a timely manner, if it's something to deal with life-saving or life issue matters, or with property issues as well. So we're a long way down this road as to whether or not what's going to be able to be eventually constructed out there. I just don't know. But I'm going to support my constituents who have asked us to intervene in this, and this is a good start to do that. Thank you.
Okay, Mr. Mayor, just procedurally, my report about conclude, believe it or not, most of it was for information.
Mr. Chairman?
Councilman Griffin, I hear your voice.
Yes, sorry, I'm driving down the road and aren't able to be seen, but I would like to make a couple of points if I can.
Yes,
if
sir.
Nobody else would like to speak.
Yes, sir, you have the floor.
I just wanted to sort of talk about a couple of things we talked about yesterday for the whole group. Number one, I believe the mayor said yesterday that he doesn't actually need our consent in order to write a letter to DHEC or a federal agency on behalf of a permit application. In fact, like he said yesterday, he's done that before. So I don't even think it needs a vote in order for him to do that. If he wanted us to vote on it for the pleasure of making it a full council vote, I can understand that, but he doesn't need our approval based on what he said yesterday to do that. In regards to this property, I made my points pretty abundantly clear yesterday that I don't think we should be getting involved in this. We're going to have our chance. We've got an active permit application through the city. We would have our time to handle that situation, as well as they're going to have to prove that they can take emergency personnel out there, and the fire marshal is going to have to approve it, and you know, there's going to be opportunities for the city to be involved. To be honest with you, if I was somebody who was looking to buy property in the city and I was listening to this, I would never buy a piece of property in the city of Charleston, because I think that this is just getting a little out of control. And this is not something that we should be taking up as a council. That's my personal opinion. And in terms of Mr. Swain, Mr. Chris Swain, who's a Citadel graduate and wears the ring and abides by the honor code of honor. We have not only honor, duty, and respect, but our honor code of a cadet shall never lie, cheat, or steal, nor tolerate those who do. I have a hard time believing that he's trying to come up with some lie about what that property's intended purpose is. I have heard from everybody who's involved in that project that it's going to be a botanical garden with some sort of shack for somebody who was going to tend the property. I don't think there's any ulterior motives there, and I don't think it's respectful for us to insinuate that there may be some hidden agenda for somebody who's been a great partner so far. So those are my points, and I'm not going to support writing a letter if we take a vote on it. Thank you.
All right, Councilman Griffin. But I think to bear in mind, Councilman Griffin, people looking at property to buy, if we took your statement and not buying property in this city, if cities don't step up and protect, we wouldn't have actually have Waterfront Park. You know, did you know that was supposed to be a private development? But the city stepped in and said it should be for all to enjoy. So there are many things around this city right now, but for, frankly, the city's vision stepping in, the public wouldn't enjoy. So when it comes to right now in the same historic watershed, the Carl Richardson Park, which looks directly across this watershed to the replica of the Adventure at Charlestown Landing, was going to be a private development. And the city stepped in, this city council, many people are still around the table, that voted eminent domain. So when you get on that ship and you look back at Ashleyville on that part, you won't see, I'll have to quote Mayor Riley, he said you won't see somebody with a grill and a six-pack with a beer looking at patrons on the Adventure. So there are times when government steps in. St. Andrews Boulevard wouldn't be there but for eminent domain and the government coming through putting that highway there. So I'm sure the private developer that wanted to put the condos where Waterfront Park is today, he walked away dissatisfied somewhat, but the city compensated him for the property. So Charleston's a good place to do business. Mr. Mayor, I want to get back to the procedures on this one. We did have an executive session of which on the abandonment of an easement, and our legal department is hopefully working on a solution to come back to Public Works. And if it passes Public Works, we'll bring it forward to the next council meeting. But I think that's the extent of my report, Mr. Mayor. Now, if we want to move forward and adding this to the agenda, or you want to write the letter or whatever, but the Public Works Committee, that's the extent of my report.
All right. So thank you. And we can just move along to our Committee on Traffic and Transportation, Councilmember Seaton.
Okay.
Thank you, Mr. Mayor. The Committee on Traffic and Transportation met today at 3 o'clock. We had a robust meeting. We took up a number of things, the most important of which I think for purposes of tonight, and I see Mr. Benjamin has now chimed in and he can give me some backup on this, is you all may recall that thanks to Councilmember Brady through the Traffic and Transportation Committee, we sent to the Bike Ped Committee of the City of Charleston the charge of taking a look in our current challenging times of COVID at some open streets, broad policies, and perhaps some specific projects that we might be able to recommend back to through Bike Ped to Traffic and Transportation and on to the City Council. The Bike Ped Committee has met on a number of occasions with everybody participating. And today we received a report from the Bike Ped Advisory Committee, which I sit on, and so does Councilmember Brady. The report was actually given to us by the co-chair, Matt Moldenauer. which recommended 3 specific courses of action in response to the charge of coming back to city council, and they are the following. The first is to take a block essentially of the south side of the market and turn it into a bike ped mall, turn it into an open street. It would be between, help me here, Keith, between Church and State Street, if I'm not mistaken.
Right.
Yes, sir. Yes, sir.
That was a recommendation that was made unanimously by the committee, and it also was made in conjunction with some conversations with Mr. Benjamin and Ms. Thompson. She was asked to go back both to the purveyors in the market and the brick and mortar tenants along the south side of the market for their input. And if not unanimous, it was very close that this was an idea that the merchants in that vicinity endorse wholeheartedly. So we brought that recommendation to Traffic and Transportation, which was to turn the south side of the market into a bike ped mall, hours to be determined later. The second was to continue to investigate the use of parklets on a temporary basis anywhere in the city other than on King Street. And as you recall, talking about parklets, what parklets are is just the taking of some space that's available and turning them into commercial space, principally for the food and bev industry, although I think you can use them for many other purposes. The Civic Design Center has been working on a parklet program, which was endorsed and adopted by the Bike Ped Committee. And the recommendation from that committee was to move forward and see if there are places in the city we can actually put some parklets in and take advantage of some space. Again, at times where outdoors is better than in, and some economic challenges are out there. The final recommendation was to ask Mr. Benjamin and his team and to get with DOT and look at the possibility and the viability of taking one lane on Wentworth Street between King and Meeting, which is the south lane. Y'all might, if you close your eyes and think about it, Wentworth Street is one way out of the city between Meeting and King Street. To take that southern lane and turn that into a two-way cyclodrome, basically. That's got its own set of issues and some logistical problems, but again, recommended unanimously to have Mr. Benjamin deal with the DOT to see if we can actually make that happen. That would actually provide one of the very few connections east-west across the peninsula for bicycle and ped traffic. Can't do it right now. So those are the 3 recommendations specifically that came from the committee. The south side of the Market Street to implement, to look at some places to put in parklets, and to authorize Mr. Benjamin to go forward and see if Wentworth Street 2 ways on the south side, 1-way lane is a viable alternative for bike ped infrastructure. Those 3 recommendations were adopted by the committee unanimously to come forward to council for authorization back to Mr. Benjamin and his team to move forward. And I believe that's the one thing that is going to need approval of this council. And I would actually ask that we take that up before I give the rest of my report.
Do I hear a motion for approval?
Move for approval.
Second.
Second.
All right. Any discussion on the bike pedestrian advisory report and recommendation? Hearing none, all in favor say aye.
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 Any opposed? The ayes have it.
Briefly, Mr. Mayor, a few more things. The hardworking Mitchell gave us an update today on signal maintenance and project updates in the city, and it was exhaustive. They're doing a lot of work. If you need to know, he's got a spreadsheet which we can share with you, but there is a lot of signalization work going on across the entire city, and his team is very hard at work on that. We also got a report from Mr. Kronsberg, Mr. Most, and their team on the Ashley River Bridge crossing. I think, Mr. Mayor and fellow members of the committee, the operative word in that report was complicated, but moving forward. We are going to get a full report from them at our next TNT meeting, but we are going to make that a regular reported item on TNT going forward, because I know that everybody's interested in that project, where we stand, where we are with permitting. And we have done some preliminary work on the permitting side, where we are with finance, and where we are as a practical matter. We will get to that as we go forward, but that was the first of many reports that we'll get. And I think to sum up what they told us, complicated, moving forward. We have a team on it. We have hired, by the way, a specific project manager in the city to do nothing but work on that project. She is getting up to speed as we speak, which is difficult in this day and age, but she's doing it. So that's moving forward. And lastly, we had an application for original certificate for a taxi, and we had a traffic calming on Blue Waterway and Bolton's Landing, both of which were approved. And I believe that is the conclusion of my report, Mr. Mayor.
Technically, do we need council approval on the certificate of
We
public?
do, on the certificate, but not the traffic calming.
So that was approved. Can I entertain a motion to approve that certificate?
So moved.
Move for approval.
Any discussion? All in favor, please say aye.
Aye.
Aye. Aye. Any opposed? Thank you. Thank you for that report. I must say it was similar to, we didn't call on you, Steve, Director Benjamin, but he could have gone on just as long as Matt Fountain did with all the things that we're working on and approvals that have come on down the line for funding for city-wide transportation projects. But given the hour, if you don't mind, we'll come back to a report to council on that maybe next.
If I might, just very briefly, Mr. Mayor, before we go in, I do apologize, Mr. Benjamin, it is late. He did give us a very comprehensive report on many projects that are going forward cooperatively with the county. And I think let's, Keith, at our next meeting, give everybody an update. Maybe we can send them out a report in advance, if that's all right.
And with the DOT as well.
Yep, DOT, because the hour is late and getting later.
Right. Councilmember Jackson.
Thank you. I actually had that same exact thought as Mr. Fountain was giving us all of his list of amazing projects that cover all the bases. And so I was going to make some cute little mark about keeping up with the TNT list. So I do look forward to giving TNT the chance to educate about why their work is going and how responsive it is to everything that the citizens have been asking for quite a while. So thank you.
And Mr. Mayor, I got the note that the county council approved the transportation sales tax list just a few moments ago. So
Great.
Either right after this meeting or first thing in the morning, you'll get a quick email from me on all the projects in the city of Charleston that were funded through the TST.
Excellent. Great work. Thank you, Keith. All right, so next we'll go on to our Committee on Ways and Means, Councilmember Gregory.
Move for approval.
Approval.
Any discussion? All in favor, please say aye.
Aye.
Any opposed, the ayes have it. Now, bills up for second reading. We have two items.
Mayor, we actually have one item now because the applicant has asked that number 2 be deferred. So we're just going to take up item 1.
Okay, item 1 to amend our business license ordinance. We have a motion to approve.
Move for approval.
Second.
Second. Any discussion? All in favor, please say aye.
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 Opposed, the ayes have it. Now for third reading and ratification.
Move for approval.
All right.
Second.
All in favor, please say aye.
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 Any opposed, the ayes have it. Next bill's up for first reading. We have the ordinance that I mentioned earlier, creating a commission entitled the Central Business District
Move
Improvement.
for approval.
Second.
Any discussion on this? All in favor, please say aye.
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 Any opposed, the ayes have it. As I mentioned, I will send you all a list of membership for the commission. I have already decided and have asked council members Seating and Mitchell to both be our council representatives on that commission.
Mr. Mayor, if you don't mind, at our next council meeting, if you can just put 5 minutes aside to make a few comments about this when we take it up for second and third reading, just, again, the hour's late, but there's a few things I think would be handy for everybody to know.
Yes, sir. I'll be happy to. We'll have second and third readings of this matter next time, and we can elaborate on it further. Absolutely. So let's see, then we did have a zoning matter number 2. the unzoned former property on Somerville Avenue to be zoned to general business. This is first reading.
So move.
Second.
We have a motion for approval and a second. Any discussion? All in favor, please say aye.
Aye.
Aye. Any opposed? The ayes have it. So, the next regular city council, meeting will be July 28th, 2020 for those, guests who are on the line with us. We do have on the agenda, request to go into executive session to discuss legal advice regarding the West Edge development. I will, share with those who are, listening in and joining our meetings that we do not expect to take any action whatsoever on this item after the executive session. We will have to reconvene just to adjourn the meeting, but that will be the only purpose. So can I entertain the motion that we go into executive session?
Move that we go into executive session.
Second.
And second, all in favor, please say aye.
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 Jennifer, do you want to give us instructions?
Yes, hold on one moment. I'm going